by The Ohio State University. If you are here, you're either living with Parkinson's disease yourself, or you care about someone living with Parkinson's disease. Whatever your reason for joining us today, of course, we're so glad that you're here. My name's Clarice Goes. I think many of you are familiar with me. I'm a nurse practitioner at OSU on the movement disorders team. I've been at Ohio State since 2020. I specialize in advanced therapies for movement disorders, new medications, symptomatic interventions, deep brain stimulation, and the intestinal pump delivery systems like Duopa. I'm very active in our PD clinics and rewarded by the work I get to do with patients and caregivers every day. I'm personally looking forward to our presentations today because they are chosen to give you information on support that's available to those of you who are caregivers of people with PD and to patients who may be looking for additional community support to manage your quality of life. There's a lot to hear about today and a lot of great a great group of experts waiting to share it. Of course, as always with any virtual presentation, a couple of housekeeping notes just before we get started. All of the attendings will remain muted and your cameras are turned off for the duration of the webinar. This session is closed caption and will be recorded for viewing later. You'll be able to get to that from our community website. As you listen to the presentations, please do not hold back on your questions. Please feel free to type them into the Q&A box. As a reminder, we want them to be more general questions, so don't disclose any private health details or ask questions about your personal diagnosis or treatment. Keep those questions really general and we will answer them as best as we can. We will, at the end of the session, answer all of those questions and the answers will be posted online. So if we don't get to your question today, we will answer it. It will be answered in written form and you'll be able also to find that on that community page. Throughout the morning, after about every 2 presentations or so, give or take, the last session is a little bit different. We will pause for question and answer sessions, which I'll moderate. So whenever a question comes to mind, please don't hesitate, put it in that chat box so we can make sure that we answer it. Okay, so today's presenters include nurse practitioner Rosina Davis and social worker Sarah Grimm, both of OSU, and Patty Callahan of the Central Ohio Area Agency on Aging, Lori Gumm of the Parkinsons Foundation, and then a special panel of experts from local support groups and organizations that you should know about. We'll learn more about each of these speakers as we move throughout the morning. At various points throughout this morning, we'll encourage you to participate in poll questions. We don't have a ton of them today, but just to give you a little interaction with us and to make sure that everything's working appropriately. So we'll do one now so you can see what they look like on your screen. So on your screen, you can interact with our poll questions by selecting an answer and submitting and clicking submit, excuse me. So let's try a practice question. You all can already see it on your screen. So of course you can read the question. Is this your first time attending an online session of understanding the disease? And then please just answer yes or no. And I'll give you a few moments to do that now, just so that you're used to it. Okay, great. Let's look at everyone's answers. Okay. So we're almost split down the middle, but 40% of you are brand new. Welcome. We hope you enjoy this session. And 60% of you, nope, we've already seen you before, but we are so glad that you're back and we hope that you get a lot out of this session. Okay, so let's try one more question and then we'll start to get into these presentations as we can. So as you'll read on your screen, question 2. I have participated in a support group, Parkinson's disease fitness class, or visited a website to learn more about Parkinson's disease or resources available to me in the past. So again, true or false? And I'll give you a few minutes to go ahead and answer those questions. All right, and let's see. Oh, great. So 85% of you have gone and found some set of support, and about 15% of you really haven't branched out yet. So hopefully everyone will explore a few new resources today, find out some things in the community that you didn't know were there, and just help you along your journey with Parkinson's disease. Okay, so thanks for participating, and let's get rolling right into our speakers now that all that housekeeping is done. So our first speaker is Rosina Davis. She is my colleague and one of the other nurse practitioners at The Ohio State University. Rosina graduated from The Ohio State University College of Nursing in 2017 with a master's degree, and she's board certified as the family nurse practitioner from the American Association of Nurse Practitioners. Prior to receiving her master's degree, Rosina was a certified rehabilitation nurse, and she worked at OSU's inpatient rehab, serving patients with a variety of medical conditions and needs. Please welcome Rosina. We are both do the same job over at Davis, so I'm very happy to welcome you. And good morning, Rosina. I'll give the mic to you.
Thank you. Thank you. Good morning, everybody. I'm a little slow at starting these things up, so please have some patience. So let's see here. All right. So today my talk is going to be on challenges presented by Parkinson's disease and more along the caregiver perspective. So what is caregiving? Who's a caregiver? Well, simply, it's someone who provides care or emotional, physical support to someone who needs it. The need can be due to a medical condition, other disability. They're a care partner. They're the people who have your back, the ones you can depend on. So some caregiving statistics from the National Alliance for Caregiving and AARP report, Caregiving in the US 2020, they had said that more than 1 in 5 adults are unpaid family caregivers. And the 2020 update revealed an increase in that number, which had went up by 9.5 million. So that was a big jump in 5 years. 39% of caregivers are men, 61% women. 24% of caregivers reported caring for more than one person. So that was up from 18% 5 years just before. And I had a quote here from Rosalind Carter about caregivers that I just found kind of interesting. There are 4 kinds of people in the world: those who have been caregivers, those who are currently caregivers, those who will be caregivers, and those who will need a caregiver. That's kind of often a lot of us, right? So some challenges people with Parkinson's disease face, and we know that these things exist. We hear about it a lot. You see it, you live it. And a lot of times we focus on what the patient's going through, the person with Parkinson's disease, and we kind of forget that the caregivers, those who are their partners in care, are also going through these things as well. So today we're exploring some of the things that caregivers can do to help out, and then try to find ways that we can help the caregivers. So let's move on here. One of the things we talk about is mobility. And so we know that there's falls risk. Internationally, falls and fractures are the reason for about 75% of hospitalizations in people with Parkinson's disease. So, they're more at risk for falls, advanced age, oftentimes, some weakness, pain, problems with balance, walking, even vision changes, drops in blood pressure. Sometimes there's a bowel and bladder dysfunction. When you have to run to the bathroom, you don't always think safely about how to get there. Cognitive decline. Sometimes people, again, it's that thinking through the process. It might be even just the process of moving. Taking too many medications a lot of times, or different medications. A lot of meds can make people more off balance, more likely to have falls, and put them at risk for things like that. So what do caregivers actually do for that? They can help with a lot of times transfers. You're getting up from a bed to a chair, you're getting in and out of a car. They can supervise people maybe if they're having problems walking. They're there to help prevent the falls. Sometimes they may not be able to help as much physically. They may have their own physical limitations. So it can be a challenge for them as far as mobility issues go. But they can also help with falls proofing the house, encouraging safety protocols in the house, anything that just gives that little extra edge and helps people prevent falls. When we think about cognitive and mental health, cognitive impairment can affect 20 to 50% of people with PD. Some studies reveal dementia up to 80% of PD. Those are scary numbers. And it's just, these are things that can happen to people. And these are things that do happen a lot of times. And so what do caregivers do with this? If someone's having memory problems, you can work to try to help them find better ways of remembering things they need to do. Be patient and understanding. It's not intentional that they're forgetting everything that you just told them. Things like this happen. You can encourage them to participate in activities so they don't start feeling left out. As far as depression, anxiety, apathy, these are very common problems. So you might be watching for the symptoms of these in people. Are they having poor sleep? Are they sleeping all the time? Are they having poor appetite? Problems concentrating, feeling hopeless, worthless, loss in interest in things that they used to do. These are very real problems, and they can affect people in a lot of ways. So as far as speech and swallowing, we know the voice tends to get softer. People's voice can kind of go downhill. Their speech can get a little bad. It can cause people with Parkinson's disease to start avoiding conversations and withdraw socially. They start saying, well, no one can hear what I'm saying anyway, so why talk? Well, then the voice just gets worse. You have to use it. So the speech problems can cause issues even with talking with the caregivers. They may not understand what's being told. So this is a big communication burden there. Encouraging people to use that voice, keep it strong, just keep talking, keep it going, keep that speech working. Problems with swallowing. Well, one, it can make people not want to eat in public because they get embarrassed, they're choking. And so, of course, that lessens social interactions. It can make it harder for the person to get good nutrition because they're afraid of choking. So, that's scary. When eating is scary, that's a real thing. And it can lead to aspiration and pneumonia. So obviously something that we really worry about. You want to encourage safe swallowing strategies as a caregiver. Sometimes people need special meal preps. You might be on a special restricted diet. Maybe it's pureed, chopped. You may have to have thickened liquids, and that can be hard for a lot of people to do. So encouraging compliance with that is a good thing. Making sure that other people that come around know about these things so they're not offering foods that are not safe. So just generally encouraging good, safe strategies for swallowing. Medical treatments. So there's a lot of medical appointments going on. There's, you need coordination of these appointments, transportation, going to medical appointments, therapies, exercise classes. There's a lot of that going on, and that can be often hard to manage. So thinking about medications and stuff as well, there's insurance issues that may need to be dealt with. As far as meds, when to take them, what are we taking? When do we need to get our refills in? Oh my gosh, we've ran out of pills. You want to make sure someone needs to stay on top of those things. Watching for side effects and reporting them to the prescribers. That's also really important. So a few other things, bowel and bladder issues, which we know about. Constipation is really common. Sometimes urinary urgency, frequency. A lot of people don't drink enough water because they say, I'm going to have to go to the bathroom more. Well, yes, that's how it works, but we have to keep getting hydrated, right? You can't get dehydrated, you'll have bad blood pressure drops. So these are all things to watch for. Sometimes there are things that we can do to help people, like encouraging regular toileting to keep the bladder empty, wearing protective undergarments, helping establish routines for people, reminding them to take their fiber pill today or something like that, or to eat their salad, different things that people can do. And we just need to encourage them in that. So I'm skipping past that part. So it comes down to also, what do caregivers really want to know? They want to know, what can we expect as the disease progresses? Sadly, there are certain things that we know we can expect, that, Parkinson's disease comes with slow progression over time. But as far as what will the next day bring, nobody knows that with anyone. And as symptoms worsen over time, sometimes every day can bring new challenges. So there's going to be good days, there's going to be bad days. And part of the thing that gives caregivers stress is that there's some unpredictability there. They need the confidence of knowing what to expect. And that can be lacking with Parkinson's issues. But as far as thinking about medical appointments, you bring someone into their provider's office, transportation, of course, moral support, being a good historian to help, tell the person in the office or the therapist what's really going on, taking notes, asking questions. It's hard for people to remember everything by themselves. We all need someone to really help us with remembering everything that's been said at an appointment. So, paying attention to information about starting medications, therapies. Are there side effects I should call to report? Know what meds the patient's taking. How are they reacting to these meds? About what's the timing on this. Sometimes people don't always remember these things. And again, it's good background information. Another good thing is to have a release of information on file so that you can call the office and talk about the patient. They can talk back with you about this. It's because of HIPAA concerns, we really need to have these things on file. Consider doing a Mychart proxy. That's another really good thing. So who do we call? So when there's something going on, you have to think, one, is this a medical emergency? If it is, if it's chest pain, shortness of breath, something that is a medical emergency, obviously seek emergent help. But if it's a slow worsening of symptoms, something's kind of going on, something's a little different, if it's related to Parkinson's, call the neurology office. But, if it's not, you might want to talk with primary care or other specialty. If it's about their heart, call the cardiologist. These are kind of common things to think through. Also knowing what is normal and what is not. Is it a sudden change? In Parkinson's disease, we don't tend to see something just change abruptly. If something is a sudden change, suddenly someone's hallucinating or acting strangely or something weird is going on, that's when you're going to say, okay, what else happened? What other change happened recently? Can I correlate this with anything? Did they start a new med? Do they have an infection? Is it some other issue going on? A lot of times when there's something sudden or a big sudden change like that, you might want to talk with primary care because they may just need a test, look for a urinary tract infection or something such as that. But remember, not everyone shows signs of infection the same. So normally we expect, they don't act like they're having a UTI because we're expecting someone to have problems with urination, burning, pain, cloudy, abnormal urine, things like that, going to the bathroom all the time or not being able to urinate. But not everyone shows these symptoms. And sometimes it's a little more vague than we would expect. So when you think about medication side effects, a lot of Parkinson's meds can have all sorts of side effects. When do you say, hey, I need to call that prescriber up and say, listen, something's going on here. Some of the meds can cause compulsive behaviors. Suddenly they're shopping online an awful lot. We're spending a lot of money. We're gambling lots. Something that's different, that's a change from their normal. Sexual urges. They're suddenly addicted to pornography or they're chasing you around the house. Something is different. Compulsive eating, maybe confusion, maybe nausea, maybe insomnia. They're not sleeping because they're taking a pill too close to bedtime. Dizziness, are they having drops in blood pressure from this pill? It could be that. Blurry vision, hallucinations. These are kind of big things you want to talk to the prescriber about. Dry mouth, very common in a lot of these medications. Urinary retention, constipation. Do they have diarrhea? Excessive daytime sleepiness, or they're suddenly falling asleep at inappropriate times, like while they're driving, something like that. That's pretty important. Some meds also cause discoloration of urine. And usually if you're started on a med like that, your prescriber will warn you ahead of time that this is common. It's nothing to be too worried about. Leg discoloration or rash. Some of these things can happen as well. So again, if you notice something like that, call the prescriber. And lastly, I just pulled up some quotes regarding burden of care because I felt these were kind of interesting. Caregiver burden is a broad, multidimensional construct that reflects the unique experience of caregiving for individuals from different backgrounds with differing levels of resilience and resources facing distinctive illness-specific symptoms. That's long. But what it means is we all come from different places. We all have different life experiences, and dealing with caregiving for people who are having their own personal experiences with Parkinson's. Some of these things can be very similar. We might be able to talk with our friends who are in the same place and they may be going through some of the same things, but everybody's going to deal with things through their own perspectives because they come from different places. Another one was greater difficulties with mobility, emotional well-being, and non-motor symptoms were unique predictors of reduced caregiver quality of life. Things we have to remember. We think about the patient going through these things. We forget the caregivers are going through these things as well. The hardships people with Parkinson's go through will affect the caregivers. When our loved ones are suffering, we tend to suffer as well. Researchers and clinicians should collaborate to incorporate the assessment and tailoring of training and supportive interventions to provide necessary support for caregivers across the U.S. So that's basically saying if we can figure out what specific needs a caregiver has, we can work to equip them with the resources they need, and then they can do a better job of taking care of their loved ones. The responsibilities of caregiving come with a lot of sacrifices, but the experience of caregiving also comes with a lot of rewards. So there's a lot of different things people are going to deal with, and we're all going to deal with them differently. And we need to find ways to help people to do this. So later in today, I think you're going to be hearing a lot about some resources that are available. So anyway, thank you for your interest and time to watch this, and hope the rest of the day goes very smoothly for you.
Thanks, Rosina. That was perfect. Okay, so now that we've had our introduction to kind of what we're talking about today and the areas that we're hitting, let me take you over to someone who knows all about resources very well. Our next presenter is Sarah Grimm. She is our new social worker over at OSU. She has come back to us. She was here before and has come back. So she has been a licensed independent social worker with over 15 years of experience in clinical social work. She's worked in the neurology clinic setting since 2013 and believes strongly in advocating for patients and families to connect with available resources in the community. Sarah, as I mentioned, is currently our clinical social worker for the Movement Disorders Clinic at The Ohio State University, and I couldn't be more happy to welcome Sarah. So Sarah, welcome, and I'll leave you to it.
Thank you. Well, good morning. I hope everybody can see my slides okay. Again, like Clarice mentioned, my name is Sarah Grimm, and I'm a social worker, longtime social worker, it feels like, and feel very honored to be working with the clinicians, staff, family members, and patients at the Movement Disorders Clinic at OSU. So I'm going to talk a little bit in real general terms about things to be thinking about in terms of resources for Parkinson's patients and caregivers alike. So later on in our program, you'll get some information on more specific items that might be available or of interest. I'm going to talk real generally, and I think it's a good piggyback to the information from Rosina. It's just really thinking about what resources might be out there, and how can I make some of those things work for me as a caregiver or me as a patient family member. Well, let's start with what is a social worker? Social workers depicted on movies and TV shows, I often don't super appreciate, but so I think it's nice to have like a nice definition of what a social worker is. So social workers are licensed and degreed professionals, and we work in a wide variety of settings, which is so nice. Because kind of wherever your care is, there probably is a social worker linked there. So oftentimes social workers are working with other social workers in the system, which is really, really nice. So we could be in, the hospital setting, physician offices, whether that's primary care, neurology, rheumatology, all of those kinds of things. Home health, you'll find access hopefully to a medical social worker in the rehab setting, schools, mental health agencies. Social workers are definitely getting plugged into more and more settings. And really globally, or our big picture role is to assist with advocacy, really trying to help bring a voice to the individual in need. Assessment, so looking at, okay, how are things at home? How are things at work? How are things at church? Just really doing a big picture assessment of what might be happening for an individual and their family. And then we help coordinate some of that care. So I personally work closely with the providers at OSU neurology. So if Clarice or Rosina or one of the other providers say, hey, this person maybe needs some information on whether it's transportation or prescription assistance programs, I work directly with that provider to help make sure I am offering, the most appropriate and most helpful information that I'm able to access. So working with coordination, linking to community services. So the social worker may make direct referrals on your behalf to resources in the community and general supportive activities to really try to enhance that social and emotional wellness of the patient and or family. And again, totally in agreement with Rosina that, looking at not only the individual living with the diagnosis, but the individuals that are helping support that person, we have to be concerned and available and supportive to those individuals as well. Kind of mentioned this already, but social workers oftentimes work in part of an interdisciplinary team of healthcare providers. And we also really try to look at the whole person. So looking at that biopsychosocial spiritual perspective. So, we're looking at things beyond maybe just the diagnosis, really looking at that big picture and the person in their environment and trying to really come up with a good game plan to get those needs met. So that's just a really kind of a general description of what a social worker is and where you might find a social worker. So what can a social worker help me with? This is just a quick picture of how I think of my role as a social worker and trying to connect all of the needs that might be out there. Certainly, there might be more needs out there, but this is kind of a general picture of the things that I tend to think about, with that patient and family being at the center of what we're looking at. So social workers can help with social needs, and we'll talk a little bit more about what those look like, but social needs, emotional needs, medical needs, financial needs. So those are kind of the big picture things that when I'm working with a patient and family or with the provider, those are things that are kind of clicking for me as a social worker, things to be mindful of. So when we kind of look at those areas, those big picture areas, social needs can look like a lot of different things. But in my head, as I'm talking to somebody, I'm thinking about, okay, are there workplace accommodations that an individual might need, depending on their situation, if they're working and living with a neurological condition. We would certainly be encouraging of individuals, working and participating in their daily activities to the best of their ability. And sometimes we can help with accommodation recommendations. Family medical leave, such a great and important benefit that some folks have in the workplace, whether it's the patient or a caregiver. So we strongly encourage people to look at their benefits in the workplace, whether it is, again, the patient or caregiver, so we can help support them in living well. And one of the ways to do that is to really access benefits such as FMLA. Additionally, disability benefits. I talk to patients and caregivers often about, okay, let's just look at what benefits are available to you. Doesn't mean you have to access them right now, but it's nice to kind of have that heads up, especially as you're dealing with that emotional piece of a new diagnosis or an exacerbation in a condition. That let's do some legwork up front and see what benefits are even there for you or your loved one. Transportation, getting to and from appointments can be a huge burden. And so looking at whatever resources might be available to an individual in their area. And these resources can be county specific, it can be age specific, it could be diagnosis specific. So really looking at, okay, these are the things that are available to me as an individual. A social worker can help you kind of be looking at those things. Financial needs. With a diagnosis, with any kind of chronic medical condition, being aware and cautious and with financial needs, I think is obviously super important as well. And so your social worker or a social worker in a clinic setting can talk to you about things such as, these are just a couple examples, utility assistance. So with winter and the cost of heating a home or whatnot, something that we're dealing with right now can be a burden. And so are there programs that we can apply for to help ease that burden a little bit? Meal assistance, not only the cost associated with meals, but if there is a caregiver that goes to work and the patient is living, at home during the daytime, are there meal programs that might be beneficial so that caregiver knows, comfortably that there is going to be a meal available for their loved one? So meal assistance programs is something to consider. And prescription assistance programs. We're all, I'm sure, super aware of the costs that come with prescriptions of all kinds. And so sometimes we just do a deep dive into what prescription assistance programs might be available to an individual. And I like to talk to patients and families about, your most expensive medicine, we might not be able to find a ton of help with. That does happen, especially if somebody has Medicare coverage. Sometimes that disqualifies them from some of the programs. But what about the other prescriptions that you're on that may or may not even be related to the movement disorder? Can we save some money on that end, free up a little bit of money for some of the more expensive things? So it could be, a completely different medication that we find some assistance for. So really thinking big picture, what would be helpful, and if and finding the programs that might be available for that. So I prescription assistance programs can be a super helpful thing, but I also like to encourage people to look at all of their prescriptions, beyond maybe what they're taking for their movement condition. Emotional needs. Rosina touched on this really well. The emotional impact of a chronic illness, a neurological condition or diagnosis is huge. And I think being, as a social worker, trying to really show up and be empathetic to what that could look like. So social worker might talk a little bit about what education and support materials are out there for a diagnosis. So we'll hear later on in our presentation about some specific education and connection opportunities in the Parkinson's disease world. But yeah, looking at all of the education, looking at supports in the community, is something that I definitely am looking for when I'm working with a patient and family. Counseling referrals, we dealing with diagnoses, chronic illness, the stressors of caregiving, all of those things. We can tap into counseling resources in the community. So we all deserve to be able to kind of talk through our story in a safe environment, and counseling can oftentimes do that. So depending on where an individual lives and what their needs look like, I can work with patient and family on linking with a therapist in their area to be an additional support. So And then caregiver resources, whether that is therapy type connections or support groups for caregivers, respite care, which is a tough one, but definitely something to definitely worth looking into. So that's just kind of like a big picture of what some of the emotional needs might look like. Sometimes I'm just on the phone talking to people and just kind of being that that verbal support that, yes, this is very hard, and we will do what, everything that we can to try to get supports in place. Medical needs could look like something like medical equipment and supplies. So really depending on what's going on at home, or what the caregiver actually might need to be a caregiver, might be something that the social worker assists with, whether that's a hospital bed or some other kind of equipment or supplies. I will oftentimes have referrals on helping people link up with those types of things. We are at the mercy of what can be paid for by insurance. So just, and that's as frustrating for me as it is for, patients and families, but there are programs that have some loan closets, some lender type equipment. So really it's a matter of just kind of diving in and doing some detective work to see what might be available. I often will help with physical therapy, occupational therapy, speech therapy referrals. A lot of times if we can get those things in the home, if an individual has some mobility challenges, I'm happy to help connect people with those types of providers in their area. And then linkage with foundations, associations, again, kind of like those loaner closets, lending type services that might be helpful. So those are kind of just the big picture things that I look at when I start to talk to a patient or family. Every social worker is going to kind of operate slightly differently, but those are the big picture things that we would be looking at. How to access a clinic social worker. So if you're at OSU, and I presume this would be the case in other health systems too, is ask your provider. Say, hey, is there a social worker that I could talk to and run some things through? You are more than welcome to really ask. Our providers are wonderful about making that referral on their own. But don't hesitate to ask. Or if you've talked to the social worker before and it's been a little bit, say, hey, I'd really like a call from that social worker again. So please do that. Please do that when you're in with your providers. If you have a clinic appointment and the social worker is in the building, you might be able to have a nice in-person chat, which I love. Putting faces to names and kind of the voice behind the phone call is something that I do enjoy. So if I'm on site and a provider wants me to see an individual, or the patient and family ask for that, then I'm certainly happy to do that. Phone calls and Mychart, but certainly probably one of the primary ways that I am accessible. So just making those phone calls in Mychart, at least in our setting, I am able to send Mychart messages. And once I do that, then the patient caregiver can respond to me. So I don't think you'll find me as a provider in Mychart unless we've kind of communicated. So that's just a little FYI. But yeah, we are out there and we're available, and there are lots of different ways to access us. Just a couple little things that I like to offer is that your story, whether you're patient caregiver, extended caregiver, your story matters. Your experience is really, really important. It's not going to look exactly like everybody else's. And I think that's why it's really important to try to access that social worker, just to see, there might be some strange little need that nobody else has ever had before, that ask. Your story and your experience matters. And it's always okay to ask for help and resources. Every time you come into the clinic, if you want to talk to the social worker, that is always okay. Again, we're at the mercy of what's available. but we can work together and do some detective work and just see if there's something that could be helpful. And that communication is key. So getting on the phone together or having a face-to-face encounter at the doctor's office, provider's office, staying in communication is how we make things happen. So again, it's always okay to ask the question. There aren't any silly questions in our world. Well, that's just kind of what I wanted to share today. And I will stop sharing, and I hope everybody has a good rest of the day.
Great. Thanks, Sarah.
Thank you.
So we are running ahead of time for once, which is lovely. So I'm going to go ahead and invite Rosina back for our first question and answer session. So Sarah and Rosina, if you don't mind to come back on camera just for a few moments to answer these questions. Remember, everyone, submit those questions in the question and answer box, and we'll get to as many as we can. We only have one at the moment, which is not a bad thing. It means that you answered all of the questions that we needed. But we do have a little bit of extra time, so I will open it up. If folks have other questions, I will do my best to answer them, even if not directly related to what we've already chatted about this morning. Happy to do so. So first question, Sarah, which you answered throughout your presentation, but I just want to go back to, one of our folks said that they didn't realize that they could work with a social worker. And that may have been true because we had one social worker for the entire neurology department. And now we have been blessed and gifted with more than one. And so Sarah has much more time to devote and help our patients. And we're so grateful for that. So how to go about finding one, Sarah, you did a great job. And I just want to highlight that a little bit, is you can ask us anytime, Rosina, myself, Dr. Marola, Dr. Chingizi, Dr. Park, Dr. Kostick, anyone that you've seen for the referral to Sarah. And we're happy to help her, happy to get that referral to you, and Sarah will reach back out to you. That way. It's very easy for us. We just put in a referral, we send in a note, and Sarah reaches back out. I really wanted to highlight one of the things that you do, Sarah, which is helping with that transition for our folks who are considering going from disability or from working to disability. That can be a really tricky thing to manage, and it's really hard to do on your own. So, even if you're just wondering what that's going to look like in the future, if you're a younger patient that's still working, Sarah can kind of help you navigate that. We try to help you. I know I try to help my patients as much as possible. It's always better to hope for the best and plan for the worst in my world. So it's just good to know what those options look like and how things are going to go in the future. And, getting Sarah involved early is always better so that we're not, at a crisis point having to try to get things together, but knowing what resources are out there. Sarah is really great with helping us getting set up for home health too. Sometimes that's been a problem in the past, and she's really fabulous about getting that all set up, helping us with getting some of that durable medical equipment too, because that's another thing that can have so many steps, and we need somebody else to stay on top of it for us, and just navigating that system is great, so your walkers and your wheelchairs and all that kind of thing can be really helpful. So we're so grateful for that. So let's see, we have a couple of other things. Rosina, can you answer the quick question of what is a Mychart proxy?
Sure. When patients sign up for Mychart, there's a way of doing it. Usually we would have people do it up at our front desk because it's something that we don't actually do much with helping people sign up for, but registration staff does. It's something where a family member, caregiver, trusted person that the patient, allows to basically have access to their Mychart, and they can sign in as a Mychart proxy. They can see messages that come in through the Mychart. They can send messages to the providers in, I forget how it says, but it says on behalf of so-and-so, I am sending this message. And so that's a very good way of getting a hold of us and sending messages to us, and can avoid sometimes phone calls. You could just send the message through the patient's own chart system.
Correct. Unfortunately, it is a little bit of a headache sometimes. It's a good thing. It's protecting your health information, but because of the proxy is there, because technically we're not really supposed to talk to folks who you haven't signed off on, so we can't just tell your medical information to everyone. So if you have the proxy, then that means that, we can get right back to you, as opposed to calling you and asking you, well, we don't have this paperwork that says that we can talk to you. So we try to be good about making sure that everyone is set up from that at those new visit appointments with us. But as anyone who has gone through a movement disorders new visit appointment, it is a long visit. Everyone is exhausted. It's a lot of information. So sometimes those things, unfortunately, slip through the cracks. But you can do that. I don't think you have to come in. If you're set up on Mychart already, I don't believe that you actually have to come in to do that. The IT team can help you. And I think there's a couple forms to sign, of course, for the patient giving you the okay to be their healthcare proxy. That's a good thing. Okay, so let's see, what other questions do I have? That's okay. So Nora has asked Sarah again how she can get into contact with you. So I would say the best way is to ask one of us, the nurse practitioners or the physicians, for a referral to Sarah. And if you give us an idea of what you'd like to talk about, that way Sarah has her mindset too and her resources that she wants to chat with you about when she calls you. You just let us know, and we are happy to facilitate that. We will also be using Sarah at our multidisciplinary clinic, which hopefully will be up. You'll hear more about that as time comes on, but hopefully that will come up in the next 6 months or so, and you will actually have face-to-face time with Sarah. She does work out of Sarah, are you always at Gahanna?
Yeah, Callahan is my primary location for
Okay.
now. Yeah.
Yes. Yeah, so Sarah is always at Gahanna. So, if you're in the Gahanna office where I see you, Dr. Park sees patients in Gahanna, Jessica Truelove sees patients in Gahanna, and I do just a half day a week. So if you're with us there and Sarah's there and she's able to, we can connect face to face. But if not, then of course we'll put in that referral and Sarah will give you a call. So those are kind of the best ways to reach out with that. Oh, this is a great question. Sarah, can a social worker help with getting caregivers set up to make medical decisions long-term in case of needed in the future?
Absolutely. That is a great one. And I'm glad somebody brought that up. Yeah, absolutely. So getting healthcare power of attorney paperwork on file, living wills, is something that a social worker could definitely help with. So yeah, it would just be a matter of just us chatting, and we can definitely work on that paperwork.
Sarah, what about the paperwork that occurs when you're thinking about, assisted living or long-term care, or kind of navigating that system? Is that also something that you can help patients and families with?
I think everything is on the table. Everything is worth a phone call, and I'm happy to do that detective work and see what I am able to do. There are certain things that I can't do, that a individual or caregiver really has to kind of initiate. But we'll talk about that, and I can still be the cheerleader, saying, "Okay, let's make that phone call." So yeah, I think every question is a good question, and I encourage people to reach out.
Absolutely. And Rosina, can you give us a little bit more information? What is the Movement Disorder Center and what does that kind of encompass?
So movement disorders is a specialty of neurology. So we're the ones who work with things such as Parkinson's disease, essential tremor, Tourette's, dystonia, other things that are classified under movement disorders. So we're just a special branch of neurology.
And our center has many parts, as most centers do these days, just trying to be more available to the community. So one of our big hubs, especially for the deep brain stimulation and the focused ultrasound, those surgical options, is over where Rosina and I spend most of our time, at Davis, which is on kind of the central OSU campus, but it is its own. If anybody knows where Dodd Hospital is, it's the other part of that building, same building, different name. Has its own parking garage, so that's helpful for our patients. And then we have an office in Gahanna, and we likely will also, although nothing is ever set in stone, we may also have some space in Dublin when that opens, maybe in the fall, maybe late summer. We'll see. Again, those are very moving pieces, so it's hard to be very specific about that. But so that's kind of the Movement Disorder Center. It's a group of everyone. the nurse practitioners, the physicians, Sarah, our social worker, our physical therapist, our rehab team, speech therapists, and occupational therapists, our geneticists, our neurogeneticist, Victoria Klee, is amazing. Our neurocognitive psychologist, so our neuropsychologist, Dr. Boxley, and Stephanie Kielb, Dr. Kielb, is also there. She's wonderful. Golly, there's just so many, there's so many people involved in the team that sometimes I know that I have left at least 10 people out. But it's a great crew of, golly, maybe 50 different providers in different spaces. And it's just that all-encompassing name that we use to represent all the providers that might help someone with Parkinson's disease within our system at OSU. But same description is usually used at the other health centers across the city and across the nation. So let's see. So we do have a slightly unrelated issue, but how do we differentiate? This is a great question, Rosina. I'll probably answer it, but you chime in if you have anything, okay? How do we differentiate between prostate issues and urinary issues related to PD? So here's the answer. You can't. They play hand in hand, and one tends to amplify the other. So we have a great urologist that we use here, also part of our movement disorders care team that I forgot. We use Dr. Crescenze a lot, but we have a lot of other great urologists as well. We just happen to use her a good bit. And what's really important, she did a great talk for us maybe 2 or 3 sessions back that you can kind of look through if you're interested. She really did a wonderful job explaining Parkinson's and what urinary symptoms you see and not. But the best thing that I really got out of her lecture was ensuring that you see a urologist who's familiar with Parkinson's disease. That's really important. And then making sure that they're teasing out those prostate issues. There are some different things that they need to tease out, some tests that they need to run and see what's going on. And then see how they want to treat from there. From a Parkinson's standpoint, patients can have a couple of different things that go on. They'll tend to want to urinate more frequently, and that can even be more of an off symptom. So they will, when your medication's working better, you don't have to urinate quite so much, although still more than you probably used to. So that's why some patients have more trouble overnight too. And we can adjust medication to help as much as possible. And we do. We use a lot of Mychart in this population for patients who have frequent urination. I forget what it's not. Rosina, do you remember what the other name for Mychart is?
It's a long name, Merbetragon, something like that. Sorry.
Yeah.
I always call it Merbetrac too. It's so much easier.
Yeah, that's the brand name. So apologies for that. It does have another name. But our patients often will use that with a combination of Botox from the urologist if they're having urinary frequency. If it's retention, that's a whole different ballgame. And that's something that's more rare in our patient population. But if it's the frequency, then we usually send you up to our urologist. They run the prostate tests, see if they need to do anything from that angle. But sometimes our patients will accidentally get treated with some of that prostate stuff that actually makes their PD symptoms worse. So that's why it's really good, again, to have someone who has some knowledge of Parkinson's disease. Usually the combination of having your medications working the best, so you're having the best on time, and then the Mychart usually at about 50 milligrams every day. And the Botox is our best. So, but my goal always is to be very honest. And, so if you're getting up 10 times a night, I hope that you get up 5 or maybe 3 or 4. You're still going to get up sometimes a night, but I hope with that process that we can cut it in about half. And then, of course, drinking your fluids early on in the day. And because I do want you to stay hydrated, because that'll give you other problems, but drinking them earlier in the day as opposed to later in the day can be very helpful. So again, about as clear as mud, both issues have to be treated, and then we just hope for the best. There is something less common where you can have some dystonia in your bladder, but again, that's really rare in a whole different ballgame. So I won't bore you with the details of that, but we can always talk in your visits if that's something that you're worried about. Okay, and then one of the greatest questions I saw in here, they're all really good questions, by the way, but an important question is what new research is being done at OSU? At the absolute end, I will give you a 10-minute synopsis of every trial that's coming up, what the research is looking at, why we're doing that, and where we're going with this field for combating Parkinson's. So don't worry, we will answer that at length. Okay, guys, so we are right on time, so please take 10 minutes, take a bathroom break, get a cup of coffee, whatever you need to do, stand up, stretch. Thank you again to Sarah and Rosina for those excellent presentations. Coming up next, I believe we will talk a little bit to the Central Ohio aging folks, and to the Parkinsons Foundation will be our next block. So take a break, and we'll see you back here at about 9:50. Thank you. Hello, everyone. Welcome back. Our next speaker is Patty Callahan of the Central Ohio Area Agency for Aging. Patty directs the National Family Caregiver Support Program of the COAAA and has been providing education and consultation to family caregivers since the program started in 2001, as well as linking individuals and families to community resources. Patty is a licensed independent social worker in Ohio and a certified information and referral specialist in aging and disabilities. Patty, we're so glad to have you with us today. And I'll welcome you in, and you are, hi.
Here. Thank you so much.
You're welcome.
I appreciate the opportunity to come share some information with you all this morning. Let's see if we can you all see the screen there?
Yes.
Good. All right. Well, as Clarice said, I manage our family caregiver support program, and that is for an 8-county service area. And over the years, I've actually been with the agency about 20 years now, talked with many families and individuals who were looking for the supports they needed to live as independently as possible. And at the Area Agency on Aging, we're all about choice and helping people understand what their options are in the way of services and supports that they might need as their abilities change due to illness, due to an injury, due to just changes with aging. So we encourage folks to do some planning We all know that, sometimes we just don't know what we need to know until we need to know it. But particularly, since we all could face some challenges with health and functioning, it really is important to be thinking about and talking about some of what our needs might be and how those might be addressed. And just to kind of give you a little bit of background, and I know that I think Rosina covered some of this a little bit earlier too. We do have an aging population. We have people thankfully living longer. And the fastest growing segment of our population is people 85 and older who may need some additional assistance with the daily tasks of living. I think actually the Rosina's information is a little more current than mine. We have 1 in 5 families actually these days providing care to a loved one. And there are many different issues that a caregiver might be having to address. And so the sad part is that many families really don't know what help is out there. And so they have no outside assistance. And perhaps it either isn't enough family to help out a primary caregiver, or again, they just, there really is no one else. So we're there to guide families and help them find whatever sort of resource they might need. Again, I know Sarah mentioned earlier, it can be a wide range of needs that a social worker might be assisting you with. And we have a whole team of them at the Area Agency on Aging that can help you connect with the appropriate resources. But in terms of the long-term services and supports, we do, as I said, really encourage planning ahead. And just a real organized approach, a time to really sit down and think through, based on our current health, what we might expect in the way of assistance needs down the road. And do that in light of who we are, our personal goals, our personal values. Where will we choose to live? Do we want to move closer to family? Does our home meet our needs? And in terms of those goals and values, what financial resources do we have to make those happen, to make those a reality? That's quality of life for any of us. And so, again, very important that we sit down, think about our preferences, but not just think about them. Do some research on what help might be out there to help those things become a reality, and communicate all of that to those who might need to make things happen for us when perhaps we're not as able to. And that's where the Area Agencies on Aging come in, better known as the AAAs. We are an aging network that was provided for under federal law, the Older Americans Act of 1965. And we administer programs and advocate on behalf of older adults and individuals who are living with some sort of disabling condition and their families. There are actually over 665 of us in the United States, 12 in Ohio, and we all typically serve multiple counties in our service areas. And the area, there's the map there of all the area agencies on aging in Ohio. We are starting points in finding all sorts of long-term services and supports. We fund some community-based services through that same funding under that same legislation, the Older Americans Act. That goes out to provider agencies in the community for things that you may be familiar with, like home delivered meals, personal care, transportation. We provide information and assistance and education on a whole range of aging issues, and also assistance in accessing direct access linkage to services in the community and community resources. And then at all levels of government, we advocate on behalf of older adults, their families, and individuals living with disabilities for the funding that really is what it takes to provide adequate services for individuals to live as independently again as possible. In Ohio, we administer some programs that we refer to as Medicaid waiver programs. And these programs are alternatives to nursing home placement. They are intended to bring the services to an individual in their home. And they are a type of Medicaid. This is one place where Medicaid pays for long-term care. So all over the United States, as I mentioned, there are these area agencies on aging, and we frequently are talking with families from across the country who have a loved one back here in Ohio, or someone here in Ohio who's trying to figure out, whether they bring a loved one from California to Ohio to provide care, or maybe it makes more sense for them to stay where they are and to bring the services in there. So we can connect you, if you call us, to any area agency on aging in the US. But also you can reach all of us through the Elder Care Locator. That's a national resource. And all you need is the town that somebody lives in, and they can get you to the area agency on aging that serves that area. In Ohio, we all provide free long-term care assessments. This is a nice way to kind of open the door to that conversation I was talking about. We're just sharing information. We're not coming out to actually put anything in place. And our caregiver advocates can provide one-on-one consultation around a whole range of caregiving issues too. And sometimes, we have to kind of think about plan A, B, and C, depending on what's going to fit the situation. Every caregiving situation, as was mentioned earlier, is very individual, and we understand that, and we're happy to schedule some time to sit down and go over what the specific needs are in a given situation. We also produce all sorts of materials around community resources, and those are available on our website at coaaa.org. And there, that slide just is to show you a bit of what they look like. The big purple guide up there is kind of like a phone book for community resources for older adults. There's a lot of information in there, so I tell people use the index. Again, we're happy to mail these hard copy if need be too. They are on our website. And then the next book there that you see in orange is the Caregiver's Toolbox. And that's the handouts from a whole series of workshops that we developed at COAAA for caregivers on a very wide range of topics. I always say, I know as a caregiver, you probably don't have a whole lot of time, but if you can, you get this booklet, read the first chapter, because that's going to tell you what's out there in the way of help and how it's paid for, and really give you the nuts and bolts. We really try to cover things thoroughly in this book so that you really can navigate. We know that there are many different confusing systems and payer sources for care. And so we really tried to give you the details in that booklet. But it also covers everything from managing care in the home to managing care and if someone is in a care facility, to navigating healthcare systems, and even preventing burnout, a chapter just for the caregiver, to give them some ways to help monitor their stress level and some strategies to help them relieve any caregiver stress as much as possible and prevent burnout. Some of those other guides that you see there are specific to caregiving, and that might be, for example, a guide that we produce for private home care. There are government-funded programs that can help with the cost of care. I'll talk about those in a minute. But we also know that there are families that won't need those programs, that they do have the resources to hire either an independent, self-employed individual or just go directly to an agency. But sometimes that when they do that, they don't necessarily have a care manager involved. And that's your go-to person. That's your guide. It might be a nurse, it might be a social worker, but that's the person who generally knows how to get whatever service or care that is needed and what typically pays for it and can help navigate. So in that guide, we also include a whole list of provider companies, medical equipment providers, providers that do home modifications for accessibility and safety, home delivered meals providers, just a way to get somebody started who is maybe going to be navigating a bit more on their own. There's a respite guide that is a respite, if you haven't heard that term, is just whatever is going to bring the caregiver a break. And heaven knows that we know that is very much needed to be able to go the distance in caregiving, because we don't know what the distance is going to be. And so we have to pace ourselves. And so that means taking some time out to attend to our own needs as a caregiver. And there are different ways we can provide that. That might be through an agency sending an aide into the home. It might be a loved one going out to adult daycare, to a center in the community where they have activities and a noon meal, and medications can be administered while they're there, but they have someone watching out for them through the day. We have a guide to support groups, and then we have a guide, the long-term care and hospice guide lists every adult care home, assisted living and nursing facility in our 8-county service area. And I know I heard earlier, transportation is, we know how important that is, and often how difficult it is to find and to find a company that can do this at the time that it's needed. Most transportation programs are not on demand and require some lead time to actually schedule the transportation. Sometimes an escort is needed, sometimes ambulance transportation is needed. We have tried to put everything in that guide, every transportation resource that we're aware of for our 8 counties, right there, one place in that guide, and how they work and all their eligibility criteria. And I know also Sarah mentioned earlier that there might be a need for some help with things like utilities or some of the assistance programs. In the guide on utilities, we've spelled out every program that's out there in our community that's going to help with utilities. And also these days, due to the pandemic, there is some additional funding out there too among agencies that in the past haven't necessarily had funding for that sort of thing, as well as for rent assistance. So I just want to mention that. Reach out to us if that is a need, and we'll be happy to direct you to that additional funding that has come about due to the pandemic. We have a guide for prescription assistance programs. Again, every program that we're aware of, every strategy we know to get help with prescription costs. So that's just kind of a synopsis of some of the guides there. And again, we're more than happy to mail those if you want a copy of that. Our website has a lot of information out there. Many of those workshops that the handouts I mentioned are included in the Caregiver Toolbox booklet are actually now in video form on our website with the handouts right there next to them that you can download the handouts. And that's all under our caregiving section on the website. Aging.ohio.gov is the Ohio Department of Aging's website. And again, lots of good information out there as well. And they also maintain this website, ltc.age.ohio.gov, which is a long-term care guide, I guess is the best way to put it, to all facilities in terms of group homes, assisted living, or nursing homes, where you can actually get some quality data on the facilities. And you can do a search for whatever type of facility you're looking for in whatever county you need it in. And it also lets you filter on specific services that a facility might offer. For example, short-term respite care. Pro Seniors is actually a legal website and hotline in Ohio for seniors. They have volunteer attorneys that can answer just about, just a wide range of legal questions, and wonderful fact sheets on their website that actually do explain the nuts and bolts of Medicaid around some of these programs that everybody needs to know, because often, for many people with middle range resources, Medicaid at some point may be the payer for long-term care. Disability Rights Ohio is a great organization that also is an advocacy organization for individuals who are living with disabilities, and they are the experts on the Americans with Disabilities Act and reasonable accommodation rules and regulations, and can certainly be an advocate if that's needed. So I know I've talked about services and supports, and so what are those? Well, again, some can be provided in the home and the community. Some are facility-based, and costs vary considerably, and so does availability. And I'm going to have to say today that right now we are struggling with a significant workforce shortage across the board in long-term care. We knew that this was the situation prior to the pandemic, but it's also been exacerbated by that. So I just want to put that out there that yes, the programs are still there. Yes, we're still serving people, but you may need more of a backup plan than you would have in the past, just due to a shortage of home care workers and workers in care facilities. But the community-based services are more than just that. They do include things like home delivered meals. And I always say these are not the tasteless mush that we tend to think of years back when we talked about Meals on Wheels. Many of these providers are catering companies. There's a lot more choice on what you get on a daily basis. They don't have to be just a hot meal delivered in the middle of the day, but that has other benefits because it has someone also kind of checking up on a person. But they now can also provide them as a group of frozen meals that you can just put in the freezer and pull out as you need them. You can pay privately for many of these services if you need them. And then there are government funded programs that can help with the cost too, that they might actually be included as part of the care plan. Again, transportation services, as I mentioned, the adult daycare or adult day health, the centers where an individual can go for all or part of a day. Respite care, again, can be provided by those aides that come into the home. In-home therapists, typically that's going to be covered under medical insurance or Medicare, Medicaid. Companions, that's just an aide that basically comes into the home to just kind of stay with someone and provide supervision. Folks, homemakers that can come in and do some light housekeeping, your heavier chore work, maybe light yard work or minor home maintenance. Telephone reassurance programs, we have one through the state now where you can register and they will send a call once a day at a time that you prefer. If you don't respond, then they will notify an alternate person to let them know that perhaps they need to check on you physically. Of course, nurses, again, that's typically going to be under Medicare or insurance. And then the case management or care coordination, that is available through those government funded programs that I mentioned. That's also available private pay. In our area, we do have some private fee-for-service geriatric care managers. And for families that are going to be paying privately, that can be a tremendous resource and relief. Again, that's your navigator. So in each of our 8 counties, there is an agency that's the focal point for aging services, and we've got them listed there. They're also listed in all of those guides just inside the covers that I just showed you a little bit ago. And then I just want to briefly say that we know that, again, until you're right down to the wire, sometimes this isn't something that you've been thinking about in terms of how long-term care is paid for. Medicare is health insurance, and there is very much a long-standing misconception in the community that Medicare pays for long-term care. It does not. It pays for health care and it pays for short-term care in a facility on a rehabilitation basis, and perhaps some short-term care in the home, typically short-term, maybe a little bit longer in some cases, depending on the need, while there is a need for a skilled nursing service or a skilled therapy. Sometimes there are some benefits too for some more maintenance type therapy, but that's the limit. It isn't going to pay for ongoing care in the home over a long extended period of time in terms of sending in home care aides. That's going to be some of the Medicaid programs that we refer to as Medicaid waivers. And Medicaid is state federal assistance dollars that pays both for health care. It generally isn't known that it also pays and is a major payer for long-term care. It is for individuals who have limited resources and again pays for long-term care both in the community and in a care facility. And the waivers, and that's just we use the term waiver just to make a distinction between that and the Medicaid for healthcare, because these are home care programs, very comprehensive programs that provide a whole range of services as part of the care plan. And they are an alternative to nursing home placement. An individual does need to require as much care as an individual living in a care facility to qualify for these programs. The Medicaid for these programs, though, is the financial criteria is quite different than the Medicaid for healthcare. It is more generous. It looks only at the income of the person who is going to be enrolling for the services, not household income, like Medicaid for healthcare, very different there. And some assets can be retained in the case of a couple. So we, if someone is looking at these programs, we do encourage them, if there are some resources, to have a conversation, a consultation with an elder law attorney, and we can help you find them in our area. Those attorneys know Ohio Medicaid law, and they can explain the ins and outs of the financial eligibility criteria for this long-term care Medicaid, whether it is for one of the waivers or whether Medicaid is going to be needed to care for to provide care in a care facility. We do have a waiver specifically for people under 60 in Ohio. Passport is the waiver for people 60 and older. And then there is some funding for assisted living in Ohio, which is referred to as the assisted living waiver. And then the Mychart Ohio waiver is just similar to Passport. It's just that there is a managed care entity involved. And then many different waivers in Ohio for individuals who are living with a developmental disability. The program that I've administered for the last 20 years is the National Family Caregiver Support Program. It came about because many years ago there was a realization that caregivers are the backbone of long-term care in the United States. We can't do it without them. That's to the tune of $470 billion of unpaid home care a year in the United States. And so with this realization was also an understanding that caregiving does come at a cost for the caregiver, physically, emotionally, financially sometimes. And so this program came about to provide some initial support. It is short-term. It can provide a little bit of respite care, perhaps some emergency financial assistance on a one-time basis, maybe help with a minor home modification, maybe help with some medical equipment, incontinence supplies, things like that. This is a very easy program to access. No one has to access it through me. We have a partner agency in each of our 8 counties, pretty much those same agencies that were the focal points for aging services in their counties. And you can go directly to them to access the help through these programs or through this program. It will look a little different in each county. And the beauty of that is that each county partner knows the other resources in their county. So it may be that they have a better way to meet a need than through the caregiver program that's going to be more ongoing. No financial criteria for this program. Caregiver doesn't have to be living in the home with someone. It is primarily for caregivers caring for someone 60 or older. There are also services for kinship caregivers under the program and for caregivers 55 and older who are caring for someone of any age with dementia. So no major hoops to jump through here. The financial there is really no financial criteria. We're looking at just a suggested donation basis only because this is Older Americans Act funding. And that suggested donation is based on the income of the older adult. No one is denied service if that's not affordable for them. It's just exactly as it sounds, it's a suggested donation. Right, happy to take any questions, and I thank you so much for your time today, and you have a lovely rest of the weekend.
Perfect. Thank you so much, Patty. We will do questions after Lori's presentation.
Hey.
So you're welcome to take a quick break.
Okay.
Great information. Everyone, don't panic. We will be able to provide slides and things later, and they will be posted on the website. So for all of those things, you'll have more information. So next up, we will hear from Lori Gumm, the development director at the Parkinsons Foundation, the Great Lakes chapter, one of my favorite people. Prior to joining the foundation in 2020, Lori has a long history in community activism and working to reduce disparities in healthcare and human services for underserved populations in Central Ohio. In April of 2021, she became the development director of the chapter and now oversees all foundation activities for Ohio, Michigan, and Western PA. Lori's favorite part of her job is connecting directly with members of our Parkinson's community and helping to make people with Parkinson's lives better every day. So without further ado, welcome, Lori, and I'll give the presentation to you.
Thank you so much. And I first of all want to say Clarice is one of my favorite people too. And I'm just so thankful for the opportunity to be here today. And just to say that the Parkinson's team at the OSU Wexner Med Center, what they do for this community is just amazing. I'm so thankful for that. And they partner with us all through the year for different events. So from the bottom of my heart, thank you very much for all you do. So I'm going to bring up my presentation here. Okay, there we go. So yes, we do serve. I'm a development director for the Great Lakes chapter, as Clarice said. That is Ohio, Michigan, and Western PA. I actually reside here in Columbus. So let's just talk about who gets Parkinson's. So there is 60,000 new cases diagnosed each year. Nearly 1 million Americans living with Parkinson's in the U.S., and there are 55,000 people in the Great Lakes chapter with Parkinson's disease, second most common neurodegenerative disease, and we expect the prevalence of this to increase. And we say this every day, there's no cure, but we can use treatments and expert care to improve the quality of life. So the Parkinsons Foundation is a national foundation. Again, we're an individual chapter of that, but really working to what we say is making people with Parkinson's lives better every day. We mean that, we really do. And that is providing people with Parkinson's, their caregivers, and the Parkinson's community with the resources that they need. So some of the things we also do, we have set the standards for expert PD care through our centers of excellence. And that's setting a very high standard for the treatment of people with Parkinson's with the latest information. So, you know, we've really created a bar there, I think, that has been very effective. We have the Parkinson's Outcomes Project that tracks 13,000 participants. And again, this helps with research to understand Parkinson's disease. And we have professional training programs that educate nurses and doctors and physical therapists across the country. So the best place to find our resources is at the Parkinsons Foundation homepage. That is Parkinson, no S at the end, parkinson.org. And don't worry, they're going to send out a sheet with all of these web addresses. So you don't have to worry if you miss one here. So going to that website, you can access everything that I'm about to talk about. So I'm going to talk about resources first. So this is the page, the screenshot of the resources, and we're going to go over a few of them here. So we have educational books, webinars, fact sheet, videos, podcast, you name it. We have every medium possible for our educational resources. We have Aware and Care hospital kits. I'm going to talk about that in a minute. And we answer nearly 20,000 calls annually through our helpline. I'm going to talk about that too. And encourage and guide those who are newly diagnosed with our brand new, newly diagnosed kit. Again, all those are available at our resource website. So here's one of the things that excites me most about what we do. We have created and give away Aware in Care hospital kits. So what is that and why is it necessary? Well, we know that one of the most important things is that people with Parkinson's get their medication on time. We've talked about that already today. Well, what happens when you go to the hospital, and particularly you go to an unplanned hospital visit with an ailment or an injury that does not have anything to do with Parkinson's? Often the first thing they do is take away those medications until they figure out what's wrong. Well, you also have to understand that a lot of emergency room doctors and nurses may not know that much about Parkinson's disease. So this is a kit that helps you advocate for yourself, for your the need for getting medicine on time and understanding. We have the information you can present to those hospital professionals right then and there. You can see the contents here on the right, and there's even a little magnet that goes up. You know, that whiteboard where the nurse comes in and signs her name. It's a little magnet that says, I need my medications on time. So it helps you advocate for that. So again, these are very effective for unplanned hospital visits, but of course, also for planned visits, because we also recommend you take this nice little case that all this comes in and put an extra set of your prescriptions in there so that if you have to grab that bag unexpectedly, you're going to have your Parkinson's medications readily available when you get to the hospital. And on top of that, we have, as you can see, Jerry Boster here, we have Aware and Care ambassadors. We have trained volunteers that go out and educate the Parkinson's community about these kits. And they also go out to visit hospitals and hospital staffs to let them know about this kit. This kit is available as a resource on our website. It does cost $8 for shipping if you want this little bag, which is really cool. The contents are downloadable for free, but I'll get to it in a minute. If you come to some of our events, we can just hand you one of those for free. So we have given out 5,000 of these kits in Ohio over the last 3 years. So that means we have 50,000 people still to distribute these kits. So please reach out and get one of these. We've had so much feedback about just how important that has been to people. Again, we have a brand new newly diagnosed kit that gives you the essential resources. And not only that, there's inspiring stories that talk about, resilience of people living with this, living their best lives. So, being newly diagnosed can be extremely overwhelming, not just for the individual, but for their families and their care partners and their caregivers. So this just helps you begin to navigate your journey with Parkinson's. And as we've heard and from Patty and everyone else before, it's so important to give care to the caregivers. We have a lot of programs for caregivers here at the Parkinson's Foundation. And so we have our helpline. That helpline is attended by nurses and doctors. It is really top notch. So we encourage not only people with Parkinson's, but care partners to reach out to this helpline. It is really fantastic, even for references for medical professionals, or let's say you need a walker or some movement assistance. They can help you with just about everything. We have caring and coping books, and we have these great care partner courses online. Some of them are self-paced, and we also have very often, about twice a year, a live care partners town hall. So you can go and participate live, just like a webinar like this. And we do breakout rooms where, individual care partners get to talk to each other. Here's the big biggest giveaway, the biggest takeaway from this is you are not alone. And sometimes for care partners, it can feel very, very lonely, especially in the beginning. We are here for you, and there is a community there to help you and support you. Um, we come to exercise. You're gonna hear about some great exercise in here in a bit from Jackie and Jared. But we have learned over the years that exercise is the best way to delay the symptoms of Parkinson's. The best way. We call it. It's like one of the best prescriptions for Parkinson's. So when you get diagnosed, what your motion disorder specialist or doctor is going to do is going to get you into a robust exercise program. We promote that. All of our events promote exercise. And here you can find so much that we have at the foundation. We've got fitness books. Every Friday, it's called PD Health. We have a called Home Fitness Fridays. We do live fitness seminars and classes on live on our websites. So you can go there again, Parkinsons.org exercise. There's so much there. Again, you can do a lot of this at home on your own time when you have some moments. So again, every one of us here today is going to be talking about the importance of exercise, and we really want to support that. So not only do we offer these resources, we invest in breakthroughs and research. We invest now the numbers increased. We invest $10 million annually in research. One of the things I'm most excited about too, PD generation. I'm going to get to that in a minute, but we award research grants and fellowships. We invest in research center. We train research advocates, and we are really invested in that end of Parkinson. Again, and really invested in not just research for a cure, but research to find better ways, again, to make people with Parkinson's lives better every day. So again, I'm excited about this. So we have this new program called PD Generation, is a cool name too. PD Generation, and that is it is a national initiative that we offer free genetic testing and counseling to people that have been diagnosed with Parkinson's disease. This is now, we pivoted with COVID. You can get a home kit. It's a swab in your mouth. You send it back, and check this out. So after the testing's done, a genetic counselor will call you and talk to you about your genetic markers and whether or not, the reason this is important is that, do you have the gene marker, which means for your children that this might be, a hereditary marker. Interestingly enough, we've only found so far 15% of the people with Parkinson's have the genetic markers. So you say, why is that so important then? Well, number one, those markers. Number two, it also helps us to know those that don't have markers. And further down the line, should we discover other markers, we're going to have this information. So then we use those statistics with this genetic testing, again, to help us in our research. Also, I'm happy to say the great team at Wexner Medical Center offers this PD generation testing. So you can go there also. So please avail yourself of this. If you want to get genetic testing from your doctor, generally speaking, and it's not covered by health insurance, you're talking $3,000 to $4,000. So again, it just helps you understand your Parkinson's better, and particularly what that can mean to your family. So here's another great part, connecting to our community. And we mean this. We invest a lot of time, like today, connecting with our communities. We have our moving day walks for Parkinson's. We have one in Dayton, Columbus, and Cleveland. These are fantastic walks where we gather, and we're gathering again this year in person, thank goodness, where we walk together and we celebrate. We celebrate strength, and we celebrate the fact that we're all making it through. I am been so moved by these moving day events. So I encourage you to join and raise a team. It is a fundraising event. However, it is much more than that. The day of is really a community gathering that is just uplifting, and I find it absolutely extraordinary. We have a new cycling event, Revolution Columbus, on June 11th. It's a spinning event, again, to raise funds. However, great getting together together and getting on that spin cycle and getting that blood moving and sort of sweating it out with each other. It's great. And then, of course, we have our community grants program that actually gives grants to local community organizations. And later you're going to hear from Jared and his movement program. Part of that is actually we have given him a community grant for a couple of years. So again, we have a great relationship with Wexner and their Parkinson's team, and it really makes us proud to be able to invest in their work too. That's part of being, a really good community partner. So here we go. Join us. Moving Day Dayton, Saturday, May 7th. Moving Day Cleveland, the 11th. Revolution Columbus, the 11th. They're both on the same day. That's going to be interesting for me. And Moving Day Columbus. You can just go on movingdaydayton.org, movingdaycleveland.org, etc. And you can sign up for that event or at least see when it is. And join us. It's really, really an extraordinary experience. So there's many ways here you can get involved. As you've seen, all these different programs that we have. So, you can volunteer with us. You can volunteer to work with us on Moving Day. Parkinson's Champions, it's our third party fundraising. So say you're having a bowling competition and you want to do it as a fundraiser, we'll help you do that. We'll give you the tools to monitor that online, and we'll get behind your personal fundraising event. You can become an Aware and Care ambassador. You can work with us on our education events that are starting again in person. And you can we have a People with Parkinson's Council that we invite you to apply for. We very much at the national level listen to the voices of people with Parkinson's. It is very important to us that they define the agenda, they define the questions, and they define the direction of the Parkinson's Foundation. And we have a Great Lakes advisory board that we need advisory board members. So reach out to me. I'd be happy to talk to you about any of this, and come work with us. We could not do this without volunteers. It is through our volunteers that help us do what we do. Excuse me. And so not only on Fridays do we have the fitness, we have mindfulness Mondays online that deal with classes on meditation, stress reduction, anxiety relieving practices. I take it a lot of times on Monday just because, well, it's Monday. So it's a great way to start out the week. Wednesday, we have our expert briefings, and this was very effective during COVID when we had a lot of experts talking about COVID and Parkinson's, COVID and vaccines. So Wednesday expert briefings are really talking about the latest issues with Parkinson's and health and stuff you hear in the news. That's what we're going to be dealing with, very topical issues. I never miss one. They're just fantastic. So again, here's all of our information. Lori Gum, that is my, I always say sticks with you, so you should be able to remember my name. lgum@parkinson.org, and my phone number. Please reach out if you need anything. That's my job, is to help and support you. Reach out to me if you want to volunteer, you want more information about Moving Day, anything, reach out to me and I would be happy to help. Or you know what? Just call me. Let's chat. I'd like to know you better. Just pick up the phone and give me a ring. And if you take away one thing today, well, it's really two things. This is our website, parkinson.org, where you can get everything that you've already seen. And this helpline, put this number in your wallet, on your refrigerator. You can get almost any question you need answered by our fantastic helpline. Again, this is attended by nurses and doctors and therapists. It's fantastic. Please avail yourself of that. That's what it's there for. And really just have that on hand for anything you need. And you can also email questions on our helpline too through our website. So that's it. I hope that wasn't too fast. My mother always said my real calling in life was being an auctioneer. So I hope I didn't speak too quickly, but we will be sending out that resource sheet with all of this information. Please get in touch with us. Let us help you in any way we can. And thank you, Clarice.
Always, always a pleasure. And I'll highlight a few of those things as well here. But first, I would just like, Patty, go ahead and come back with us. We'll have a question and answer session now with both Lori and Patty. So if anybody has any questions, please feel free to go ahead and ask those now. Just wanted to highlight a couple of things with the Parkinsons Foundation, since Lori's just given us a wonderful talk. The moving day, OSU is always excited to be there. I know with COVID, it's been an interesting couple of years, but hopefully by the time we get to fall, we'll have some different things. And the Revolution is such a fun event. So if you can make it, if you can and be a part of it in some way, shape, or form, please don't hesitate to. And I will talk a little bit more about PD generation later too. So we'll talk more about that, although Lori did an excellent job. And then just one last thing is those, what are the kits called, Lori? What are they called?
Aware and care kits.
Aware and care kits. We also have those in the office.
Yeah.
Sometimes we are remiss and we forget to hand them out, but they really, really, really are wonderful. And we are happy to do so. I think still in those kits, they still have those cards too. I know this sounds a little funny, but they can be really helpful that say, I'm not drunk, I have Parkinson's.
Yes, yes. Thanks for reminding me. That's right. Carry it in your wallet. That's exactly right. Yeah, great reminder.
Yeah, and you can put our name and number on there. We've answered a few of those calls before, just so that you don't have any trouble just in case you're out and something bizarre occurs. We want to let people know that. Okay, so let me peek quickly at our questions. No, everything is perfect. And then Patty, when folks are kind of navigating the system and trying to figure some of these things out, like their long-term care options, what's the best way that they connect with you all to kind of navigate that process? I know you talked about it, but can you highlight it just one more time for our folks?
Sure, they just need to reach out to the Area Agency on Aging, call our main number. They will connect you with a caregiver advocate. And if you are actually know what you need already, they would just ask for our intake department, and they'll take it from there, ask about, probably about a half hour's worth of questions, and then someone will call and schedule an assessment for the services through those waivers.
Perfect. And can you tell us one more time about the PACE program? I have a lot of patients that do that, and it's just super helpful for them. So just to highlight that a little more.
We don't have PACE here in Central Ohio yet. I think it might be coming.
Okay.
But basically it is all-inclusive care for the elderly, and it is a program of all-inclusive care for the elderly. And so it is very holistic. It provides care in a range of settings, supports in the home as well as adult day care, and also brings in the healthcare piece too. So it is exactly what it sounds like. And I think there is some more interest than there was in the past in bringing it here to Central Ohio. Okay.
Fantastic. Yes, my apologies. I had all of my patients in it at Wake Forest, which of course is a few states away. So lovely. Okay. Let's see. A couple more questions have popped up. So Patty, how old, what is the beginning age that people have to be to start using your services?
Sure. Well, they're primarily the Older Americans Act services are age 60 and older, and most of these senior services levy programs, which I realize I skipped when I was giving the presentation. Ohio is unique in that we tend to pay for a lot of our senior services through county senior services, property tax levies, or sales tax levies. So that is another payer source for long-term care. In our Central Ohio area, all 7 of our 8 counties have those senior services levies. So they can get services through the levy program. Again, they can just call us. We can figure out whether it's more likely that they're going to need one of the local programs. Maybe they don't need as much help as the waiver programs are intended to provide, because again, those are nursing home diversion programs. So we'll direct them to the most appropriate program to fit their needs. And we can also talk about private pay services as well.
Perfect. Fantastic. Thank you so much. Lori, I actually don't know the answer to this question, but I should. Can family members of PD patients participate in PD generation?
Not yet.
Okay.
Not yet. What you have to do is have a diagnosis of Parkinson's
Okay.
to get that. Now, here's what's really neat, though. I didn't
Mhm.
get to this.
Mhm.
We have a new campaign called Reach Further. We are trying to raise an additional $20 million over the next 4 years. Part of the reason for that is to put 5 million additional money towards PD generation,
Mhm.
specifically to start to offer that to children of people who have the genetic markers. So we don't at the moment, but it is on our radar. We're really looking to extend that testing.
Fantastic. Fantastic. And Patty, when is a good time? When should folks start talking to some of your services on, regarding housing and some changes that should come? Should they wait until they're really thinking about doing it, or should they start when they're diagnosed, just so they know what their options are, or kind of how should they navigate that process?
Yeah, definitely start as soon as you realize that, you might have a need coming up. The sooner the better, in terms of just, again, getting some guidance and taking stock of your home, and would your home meet your needs as your abilities change. And then again, maybe you need to get out to an elder law attorney or financial advisor. There are different parts to this, and we can connect you with, the experts on each of those pieces, so that you can begin to develop your own plan. And so, I even encourage people long before there's any kind of diagnosis to understand a little more about long-term care. We're all human. We're all subject to illness and injury. And, what we really hate to see, and sadly do see a lot of, is families who reach out, right? They have waited until there is some sort of health crisis.
Yeah.
And then they're really up against it, and nobody maybe knows anything about an individual's wishes,
Mhm.
in terms of care, where they're going to live, what resources exist of their own, and it's crisis planning. And we really want to try to help you avoid that, because then it's harder to actually meet someone's preferences in terms of where and how they get help. So sooner the better.
Thank you. And I try to remember to mention this to my patients as well. It's tricky, we don't want to frighten people, and we don't want, not everyone is going to need those resources, but I always try to relate to people that, again, it's that old hope for the best and plan for the worst, again, so that your
Absolutely.
wishes are met, so that you're in a place that you would like to be, somewhere that you've toured, that has activities, and that's convenient for your family, if that's something that's important to you, that they're able to come and see and visit and all of that, but just to kind of pick out your own space and what your future is going to look like. So again, you don't reach that crisis point where you're in the hospital, and they're going to take the first bed that they're able to do that's available, because that may not be what your perfect plan was, and then there's a lot of scrambling. So I definitely agree with the as soon as possible, and so glad that you have that resource for us, because in healthcare we're terrible. We try, but we're not very educated on that, so that's very helpful.
Well, these
Um,
days too, there is a lot of support to help someone continue to age in place. That's kind of the buzzword we hear for all older adults. And universal design is something I strongly encourage people to look into too, because that's all about setting up your home so that anybody, any age, any ability can continue to function there easily. And I always believe that, it's our home that we need to take a look at as soon as possible, because you can make those changes a little bit along the way. You don't have to do them all at once.
mhm.
And there are a lot of things that don't cost a lot of money, but let you stay right where you are if that's what your goal is.
And that's a wonderful and excellent point. One question I'm not sure if you'll be able to answer, but for Knox County, what district do they contact for kind of some of that assistance? Do you know?
That is Area Agency on Aging 5. And they are based in Ontario, Ohio. I can give you the number.
Okay.
For Knox County, that is going to be Ohio District 5 Area Agency on Aging 419-524-4144.
Perfect. Thank you. And then, perfect, we're right on time. And our last question leads us beautifully into our next session, which is, where can I make contacts with a PD support group in person or in Zoom? So you're in luck for the next 40 to 50 minutes. That's what we will be discussing. When we come back, we will bring up all of the local support groups that I managed to get an answer from in the past 6 months to let me know who, what, when, and where, and we'll provide that information to you afterwards as well. So don't stress if you can't get everything written down. We'll have a sheet with all of these resources that we've talked about today, including those groups and how to contact them. And that'll be up on our website shortly. So again, thank you so much to Patty and Lori. We really appreciate your expertise and your help. To everyone listening, these are fabulous resources. Please don't let them fly by. If you have questions, just reach out. All you have to do is, say that you need a hand, and these folks can really help to direct you to where you need to go. So again, thank you. We have another break. Everyone, grab a bottle of water, cup of coffee, go to the bathroom. We'll see you back here in about 10 minutes, maybe a few minutes more. Thanks, guys. Don't worry if you're still running around getting ready to come back. No worries. We just have some introductions to do, so I want to give everyone plenty of time. I hope that you're enjoying our event today and learning helpful information to support you as you navigate your own disease or as you help care for a loved one that has PD as well. We have a wonderful panel. So for the next 40, 50 minutes, we're going to be chatting with our panel, and then there will be about 10 minutes for questions. So 40 minutes to talk to all these wonderful people and 10 minutes for questions. So please put your questions in the chat box as they come up. I'm pleased to announce our wonderful group of colleagues to talk to you about our local resources, mostly here in Central Ohio, and support opportunities around Columbus. As they're turning on your cameras, I will give you a little introduction to each person, and then I will let them start to tell you a little bit about what groups they run. So I'll start with Missy. Missy Rouse is an RN and program manager with the Alzheimer's Association Central Ohio chapter. She manages education programs, volunteers, support groups throughout Franklin County, and she's been with the association since 2017. Prior to joining the Alzheimer's Association, Missy worked in geriatric and hospice nursing. So welcome, Missy. I'm going to go through everyone. So next I have Nancy Montgomery. She worked most of her career in preventing and detecting fraud and money laundering in the financial service sector. Retiring 5 years ago, Nancy became the care partner for her husband, who was diagnosed with PSP almost 4 years ago after living with the diagnosis of PD for about 8 years. Nancy is the founder and facilitator of the Central Ohio Support Group for PSP, CBD, MSA, and the Cure PSP National Women's Caregiver Support Group, and also provides support for the Westerville PD Support Group. She's very busy for us here locally. Moving on, Susan Hervey is a native New Yorker who attended college at SUNY Albany. She moved to Columbus in 1985, working for Nationwide Insurance, and retired from there to spend more time with her Parkinson husband. They joined the L-DOPA support group at its first startup meeting, and eventually Susan became the leader. Susan started the L-DOPA D Care Partners support group, which is one of the first groups of its type in the area. Melinda McGuire, you may have seen her before. She works at the Dempsey Family Education and Research Center in Riverside Hospital, where she's the social work and program coordinator. She facilitates support groups and classes and assists patients and families in finding resources. She has a BA in psychology from Wright State University and a master's in social work with specialization in aging from The Ohio State University, where she also completed an advanced certificate program in serving veterans and their families. Excuse me. Jackie Russell is a co-founder of Total Health Works, a virtual platform for, sorry, that actually still happens, even in the virtual room. So Jackie is a co-founder of Total Health Works, a virtual platform for group exercise targeting Alzheimer's, Parkinson's, and soon MS. Jackie graduated from The Ohio State University with a bachelor's in nursing. She's been a registered nurse for almost 38 years and boasts a dedicated interest in the treatment of people with Parkinson's disease, the PWP, and their caregivers and care partners. Excuse me. Working alongside Jackie is David Zid, co-founder of Total Health Works. David graduated with a bachelor's degree from The Ohio State University and holds certifications through ACE and APG as a personal trainer and functional fitness trainer. He has been a fitness instructor in Columbus since 1997, and he is the owner and president of Total Health Works LLC, a personal training company that he started in 1999. Our last panelist you may recognize as being here a time or two before is Jared Braden, an alumnus of Ohio University, where he earned his Bachelor of Science in 2007 and his Doctor of Physical Therapy in 2010. He's a certified clinician in the Lee Silverman voice treatment, as well as Parkinson's wellness recovery. Jared has worked in outpatient neurological therapy since 2011, with the last 5 of those years at Ohio State's outpatient rehabilitation. He currently serves as a Parkinson team coordinator on our outpatient rehabilitation team. So I think I've introduced everyone. So thank you to all of you for joining us today to share information about resources in our area for caregivers and people with Parkinson's. And Missy, why don't you get us started?
Hi, thank you for having me today. It's been a pleasure to be part of this session today. Again, my name is Missy Rouse, and I am a nurse program manager with the Central Ohio Alzheimer's Association. Today, I'm just here to tell you about I manage our support groups out of Franklin County. And one of the support groups that we offer is the Lewy Body Parkinson's Caregiver Support Group. It meets currently still virtually the third Thursday of the month at 10 a.m. to 11. During our support group, we do have Dr. Charest comes on usually at the very beginning of the session, and he'll take questions and answers that anybody has. They have concerns over the month that we haven't met, and then so he'll come on. He'll stay on as long as we have questions from individuals. So our support group meets the third Thursday of the month, and we're currently virtual, so we do require registration. You can call our helpline, everything's in the flyer, or you could call me if you needed to call me directly to have some assistance to get you registered. I'd be more than happy to do that. In the future, we're hoping to be back in person with our support group. And we will still continue to have the virtual, offer it virtually as well. We're going to try to have a hybrid group. It would be 2 separate days that we would meet, but we want to continue because there's a certain audience that really benefits from it being virtual. So we have people that meet from Franklin County, all of Ohio, and even outside of Ohio for this group. So that's really about our group. If you have any information, all of my contact information is on our flyer.
Fantastic. Thank you so much. Nancy, do you want to give us some information about your group?
Sure, absolutely. I'm going to start with the Westerville area Parkinson's support group, and we're supported by Concord Counseling and the Westerville Senior Center. And this is for patients suffering with Parkinson's disease. And there are also some care partners that join as well. The group's been in existence for quite a number of years. And the purpose is to learn about the disease, the importance of exercise, medications, coping, and really getting the feeling that's like it's been a theme today about you're not alone. It's still a rare disease with many complicating symptoms, and sharing and support can really provide a lifeline for people. We do meet the first Wednesday of every month from 1:30 p.m. to 3 p.m. And right now we are doing Zoom. Of course, used to be in person, but like everything else. So an invitation is sent to the mailing list the day prior to the meeting. And I believe you see Joy Witcher's email at Concord Counseling, and we are in transition of our facilitator. So Joy is going to be our new facilitator going forward. So we have a strong core group there. As I say, have been in existence for quite a while, and sometimes we do have speakers, and a lot of times it's just discussion. So as Clarice mentioned in the introduction, I also work with Cure PSP. And if nobody knows what that is, it's progressive supranuclear palsy, which is what my husband now has after being diagnosed for 8 years with Parkinson's. And there's many, many people that have Parkinson's that end up having diagnoses of one of the atypical Parkinsonisms, which PSP is. So I just want to touch on that real briefly, that PSP diagnosis is delayed an average of 3 years after the symptom onset. And it starts with motor slowing, cognitive dysfunction, postural instability, and our clinical diagnostic features of PSP, but also sounds familiar to a lot of Parkinson's. So the objective markers of these features are evident in an average of 7.8 years before the diagnosis, and long pre-diagnostic phase in PSP with subtle changes in motor and cognitive function. In the scarcity of PSP, there's only about 15,000 in the US that have been diagnosed with that disease, is a lack of clear genetic etiology, differences between clinical diagnosis and brain bank criteria. So this is something that if you see Parkinson's symptoms and things start to change, and one of the very first symptoms, and this was the case in my husband, was the very name of progressive supranuclear palsy. So it's the nucleus of the eye doesn't move. So that lack of movement is one of the things that a lot of people diagnose PSP initially. So for more information on that, it's curepsp.org. So once we move to past Parkinson's, so we do have a couple of support groups for that. One here in Central Ohio, and I should say both the Westerville Parkinson's group as well as the Central Ohio group, we have significantly expanded our reach, and as made possible by Zoom. So, so we really have people kind of from all over the country that participate. So this is for the Parkinson's, the PSP and other atypical Parkinsonisms. This is for their partners, care partners, and the patients. We learn a lot about the disease because not so much is known about it, and who's ever even heard of it. Share experiences, provide tips to each other, provide caring and support to each other. They're devastating diseases. As with Parkinson's, there is no cure, and there's also no significant medication. So the basic treatment is for some of the symptoms, and exercise. So we meet the first and third Saturdays of each month, currently Zoom only. And after you can either contact me through the Central Ohio support group or through the Dempsey Education Center phone number or their email. And I shout out a very thanks to Melinda McGuire, who you're going to hear in a minute, for helping me set this group up. So you have the all the contact information there. And whether you're looking for support for Parkinson's or one of the atypical Parkinsonism, we're here for you. Thank you.
Perfect. Perfect. Thank you so much, Nancy. We really appreciate that. That support with those atypical Parkinson's is so critical, and we're just so grateful for you in our community. Next up, we'll have Susan. Susan, can you tell us a little bit about the L-DOPAs and the caregiver group?
I certainly can. I think before I talk about the groups, I'd just like to give you a tiny bit of background. When my husband was diagnosed, we had a terrible time finding out any information about Parkinson's. We were able to connect to a group that was starting, and that group has continued, and it is well over 20 years old now. Obviously, not all of the same people are in the group. We get new people. We still have some of the original members. The big thing we found about being part of a support group is when you're there, you don't have that feeling of being alone with this disease. Because people who come to these support groups, they understand what you're going through. And that is an amazing feeling. The other thing you get is the doctors, the medical profession will give you all of the information that they have on the medical side. But what you'll get from a support group is information about how you may be able to help yourself live on a day-to-day basis. It could be something as easy as you're having trouble rolling over a bed, or maybe you're sliding out of bed. Unusual, but that happens also. There are lots of tips available as to what to do. So that is also a great aspect. The friendships you build, the knowledge that you could call a person in your support group at 11 o'clock at night because something is going on and you just need someone to talk to. So I truly believe support groups are great. Now, the LDOPA is a group that is open to anyone who wants to hear more about Parkinson's. Obviously, we have Parkinson's patients. We have their spouse coming. We have caregivers coming, family members, and just people who are interested in Parkinson's. Any support group, what's said in the group stays in the group. So you're not required to talk, but we love it when we have our care sessions, which is just open for everyone to talk about what's going on. We also do a lot of trying to get doctors and other medical professionals, physical therapists in. We've had speakers from COAAA. So we try to give information that the group is asking for. But we also believe the friendships you develop are really important. So we have an annual picnic. We do a Thanksgiving lunch. We do a dinner at Christmas time. Friendships are very important. And we truly believe being among other Parkinson's people, people who are aware of it, can give you so much support. Years ago, we felt that the care partners weren't getting enough time among themselves to talk. So we started the LD for LDOPA's partners group. We meet once a month, and generally it's at Hunan Lion. That has changed over the years occasionally, but we find that they have a great space for a group to gather where you can talk without being overheard. All you have to do if you're interested is double check with me. And I can tell you, yes, we're meeting this month, or no, we're not. We generally do meet. The Parkinson's Partner Support Group was founded years ago by another partner of a Parkinson's patient. And you get some of the same people at both partners groups because they need that support. You get people who don't want to belong to a mixed group. I didn't tell you when they meet, I'm sorry. Second Monday of each month for the LDOPA's support group. The LDOPA's Care Partners is the last Monday of each month, and the Parkinson's Partners the third Thursday of each month. In all of those cases, contact me. I don't necessarily lead those groups, but I'm the one that's easiest to call, and I'm always happy to call people back. I think that's really all I want to say. If anyone in the group out there would like to talk more, please feel free to call me, email me, and I will get back to you. Thank you. I think that's it.
Fantastic. Thank you so much, Susan. Melinda, I believe you're up next.
I am so thankful to be part of this collaborative group today. Thanks so much for asking me. So I do work at the Dempsey Family Education and Resource Center. I always say that next to Disney World, it's the most wonderful place on earth. We are located in Riverside Hospital in the Silver Tower, right across from Starbucks. So you can grab your Starbucks and come on in and look around. We are open 9:30 to 6 Monday through Friday, and everything we do is free and open to the public. You don't have to be an Ohio Health patient to participate in our programs. And so on the right-hand side of this slide, you see a lot of our different programs that we have. I'm not going to list all of them for you since you can read them, but most of our programs right now are meeting in person with a virtual option. Some of the groups have chosen to stay virtual through the winter, but we are trying to get more and more of the groups back in person, except for music and choir because of, this whole COVID thing. We can't really have people singing in our center quite yet, but we're hoping eventually to get those back in person as well. And then I did want to talk about our support groups that we have for our Parkinson's patients. So we started out meeting at the Old Gerlach Center after one of the Delay the Disease classes. And then we moved to the Neuroscience Wellness Center. So we are meeting in person the fourth Thursday of the month at 12:30. And that is at the new Neuro Wellness Center, which I'll tell you a little bit more about here in a second. And then we tried to do that group hybrid, so in person with a virtual option, and it was really hard with masking and social distancing and soft voices and things like that. And so what we did is we added just a virtual only group as well. So that group meets the second Wednesday of the month from 11 to 12, and that is over Zoom. And I did want to mention that if you are coming to the in-person group, we do need you to register because there is limited space, although the room is pretty big. So it would take a lot of people to come before we would have to turn anyone away. And our our Parkinson's group is so amazing because as Susan was saying, they just become friends and family. And so when COVID hit, one of the people in that group took it upon himself to send out like a weekly email touch base and asking questions and making sure that they were still connected. There were a couple of write-ups in the paper. He wrote some letters to the editor, and then they also started meeting once a month for lunch on the first Friday of each month. And so it's not an official support group. It's just kind of a time of socialization. But that group is just amazing with how much they care for each other, how much they are a part of each other's lives and interact, not just in the support group, but outside of the support group as well. So I did want to mention, because Ohio Health does have exercise classes in addition to those support groups. So they do have the Delay the Disease program, which is their evidence-based fitness program designed to optimize the physical function and help delay the progression of symptoms associated with Parkinson's disease. You can find all of the Delay the Disease information at ohiohealth.com. I will let you know that there are Delay the Disease classes at Prairie Township Community Center and at several YMCAs here in Central Ohio, including Delaware, Grove City, Hilliard, and Gahanna. And then I told you that I wanted to tell you a little bit about the Neuroscience Wellness Center. The Neuroscience Wellness Center also offers Delay the Disease classes. It is brand new. It was open, I think, last May. It is a wellness center that is for neuro patients and their caregivers. And so it has 3 multi-purpose fitness studios, an indoor walking track. They also offer wellness and education programs. They have a quiet mind body studio for yoga. And then they have, exercise physiologists that are there and can help. And so, like I said, it is available to both patients and caregivers. And so you can sign up together, and the patient can maybe take a Delay the Disease class while the caregiver is maybe sitting out and talking to other caregivers, or walking on a treadmill, or taking a yoga class or something like that. But it is a great resource for both patients and caregivers. It is a wellness center, so there is like a gym membership required, a monthly membership, but they do a lot of great things over there, including those Delay the Disease classes. And then one last thing I wanted to mention that Ohio Health has to offer is just specific neuro rehab facilities. So if you need PT, OT, something like that, we do have rehab facilities that are specific to neuro patients. They are in Upper Arlington on the east side at Doctors and Grady. We also have them in Marion, Mansfield, and Athens, and we're going to open one in Westerville here in a little bit. But we would love to see you at the Dempsey Center. Again, all of our programs are free, and you don't have to be an Ohio Health patient to participate in those programs. Thanks for letting me talk about my favorite place.
Fantastic. Thank you so much, Melinda. The centers are all so beautiful. And so always enjoy, getting those opportunities and knowing what's going on over there as well for our patients. So we will start moving into some of our exercise programs. So without further ado, Jackie and David, can you take it away and tell us what's going on at Total Health Works?
Yeah. Can you hear us all right?
Thanks, Clarice. Hey, everyone. Hi, Jackie.
Hi, David.
We're going to talk about Total Health Works.
We're going to talk about Total Health Works.
You know, the easiest way to learn about us is just to go to our website, totalhealthworks.com. Gang, you know what? Jackie and I actually wrote the book for exercise in Parkinson's.
Didn't we now?
Oh, wait, 2 books. We're still doing what we love to do. We've actually expanded into dementia, so mild cognitive impairment,
early stage
Alzheimer's.
Dementia, early stage
Yep.
Alzheimer's, and
MS now.
MS.
So isn't that cool?
Yeah. So we are the neuro fitness platform. That's what we are.
That's right. And we are continuing to grow. We do have in-person classes here at our studio on 5th Avenue in Grandview. But you know what? COVID just does the same thing to everybody. So we are limiting our classes right now. And we think that's just the most responsible thing to do right now. So we're doing a lot of one-on-ones.
We're doing a lot of Zoom.
Doing a lot of Zoom.
Our Zoom classes, we teach at noon, 5 days a week.
Zoom.
But we get a good following. We may have 50 or 60 on our Zoom exercise classes. Monday and Wednesday, we target cognition and
brain and body is Monday and Wednesday, and that's more about memory. And then Tuesday, Thursday, Saturday is Parkinson's
specific. Yeah,
So-
we have all levels. We have boot camp. We have easy moving it, and we love what we do.
We sure do. We've
And-
got live classes. We also have pre-recorded stuff. So
we do.
we'd love to see
a little
you.
bit of everything.
Please come join us, because I'll tell you what, we are still developing new exercises for Parkinson's.
Yeah.
And now for brain and memory, and also for MS. So
Well,
it's pretty cool.
And anyone with an aging brain, and there's probably no one on right now
Huh.
that has an
If
aging
anyone has
brain.
an aging brain out there.
That's what our Monday, Wednesday classes target. You know, every Wednesday it's a free class. You can log in and check us out on a Wednesday at noon. See if you like what you see.
Yeah. Eat lunch while you're training with us. No,
Join
don't do
us.
that.
Yeah.
Hey, you know what? There's a lot of great support groups out there, and we've been so lucky to meet most of these folks,
Yeah.
and they're wonderful people. And it's just so great to see you all. You know, PSP, I tell you, we've met a lot of people with PSP.
do,
We're probably,
yeah.
I don't know if we're some of the only people to see that, but we see quite a bit of it. So our hearts go out to those families, and
there's
Thank
hope
you.
out there for them. There's
There
actually
is
hope
hope.
out there for everyone. And that's what we're about. We dish it out freely. Come join us.
Yeah.
TotalHealthWorks.com.
Thanks so much for having us.
Thanks.
Oh, you're so welcome. Can you give us a quick little idea of what a boot camp might look like? Several of my patients have asked, so I'm going to interject a quick question.
Oh, what a
Boot
camp would look
camp. We
like.
just taught
All
a
right,
few
I'll
boot
tell you what,
camps.
let's do a little 3-minute boot camp.
Let's
Jackie.
do a
All
3-minute
right?
boot camp.
Sounds great to me.
Please all join us. Get up out of your chairs. I know you're all anxious for this.
Perfect. Thanks, guys.
So, boot camp is what draws a lot of people to us. Saturday boot camps are busy. And
Just say for the sake of argument, Jackie, I'm going to have you show a low level. I'll show a little bit higher level.
yep, I'll do a low level boot camp.
Okay, so we've got a clock. Actually, I got to get the clock going.
We're going to start the clock. We're going to do a little bit of cardio. We'll do a little bit of brain work. We'll get it all done in 3 minutes, and we'll have a little bit of fun. So join us if you'd like. I always show a lower. impact version. David always shows the get after it version.
Absolutely.
Here
So let's
we
get
go.
after it. Tell you what, let's do a quick 20 on, 20 off. That means we've got a 1-to-1 ratio, classic interval. So nothing fancy here, but we're going to work for 20 seconds and then we're going to take a break for 20. You ready?
I'm ready.
All right, I'm just going to do some marching in place. Here we go. So we've got 20 seconds of just moving. Okay. Make sure you're safe. Hey, gang, if I need to hold on to the wall, I'm holding on to the wall because this is cardio, isn't
It's
it, Jackie?
cardio, but if you have equipment, jump on equipment.
All right, we are almost there. I love the 20s, Jackie, because they are quick.
You can get 20 seconds done.
That's
Boom.
time. All right, 20-second
Breathe.
break. Tell you what, let's do 3 of these today. All
I
right.
like it.
So what do we do for rest? Hey, I hang out.
I kind of like to move
I know
through
you
my
do.
rest.
I know you do.
I kind of stretch it out a
Jackie
little
pretty
bit.
much moves all day long. I like to take a break when I rest. All right, you ready?
Oh,
Here's another example of what to do. Here we go. I'm
Here
going
we
to do
go.
some skaters.
I am doing jumping jacks in a chair. You know, you could add weight to this. You could be on the floor using gliders. Hello,
Isn't that a
boot camp.
swear word
That's-
in Ohio? Gliders, especially in Columbus.
Yeah. Come on. I hope you're joining us. I hope you're out of your seats.
That's your time. So there's that 1-to-1 ratio, but it really feels like the rest is way shorter than the work.
We've got one more round coming your way. I'm
I'm
going
gonna-
to add some weight.
So you're going to add a little weight? Okay,
Yes,
I'm going
I
to do an
am.
imaginary jump rope because I actually brought one with me today.
Oh, don't trip on your imaginary jump rope.
All right, gang, last 20 seconds. Let's get the heart rate up a little bit. Here we go. You know, getting your heart rate up really activates the brain. There's a lot of great neuroprotection going on in the brain.
Yeah.
Neurogenesis, neuroplasticity.
Let's
What is
rewire
all
your
that
brain.
stuff?
Yeah. Let's make it relearn something that you might have lost from Parkinson's. Get breathless and then practice
3, 2,
perfectly.
1. That's
Woo!
your time. All right. So how high up should we be?
Well,
Like this?
no, not a knee
Can't
grabber.
talk to you right now. No. But you should have some difficulty talking.
Yeah, a little
okay?
bit breathless, just a little.
You know, over the last 18 years, Jackie and I have seen people, we get heart rates up and then we let you come down before we ask you to do some brain exercise. And that's
Yes.
the best recipe that we can give you is let's get the heart rate up, let it drop a little bit, and then let's show them what we're going to do for brain work.
Let's do a little bit of brain
Hey.
work, something that's going to help you.
How about a little multitasking?
Well, I
Can we do that?
love multitasking.
All right, so seated or standing, what we're going to do is we're going to take a big step forward with your left foot,
Left foot.
okay? And then we're going to raise your right arm over the head. And we're going to come back. All right. So we always start and finish in the same spot. Now, let's do that 3 times in a
All
row.
right, I'm
Okay. So
ready.
the left foot, right arm. Just think about that. Left foot, right arm. Good. Relax your jaw. Take a breath. Okay. Here we go. Left foot, right arm. Bam.
Always looking up.
We're always looking up.
Always
One more
looking
time,
up.
please. Same side. Left foot, right arm. All right. Take a little break. I'm nice and wide. No balance issues here. Here we go. Right foot, left arm. What does that mean to you? Right
we go.
foot, left arm. Here we go.
Opposite
Bam.
side. Looking up.
We're going to do 3 in a row. Here we go. Nice and big. Taking a step, lifting the arm. All right, Jackie, let's put this together. Let's alternate. Every other step, we're going to alternate. So here we go. Left foot. Now the right foot. Oh, smoke coming out of the ears.
Brain's
maybe?
working. Hey, this is
No
posture.
kidding.
This is big movement. This is brain work.
This is brain work. And I'll tell you what, if you can get better at this kind of stuff, I'll tell you, it puts you back in control. It really does. Exercise, we've seen people that are really come in, they feel like they've lost control of their lives, and exercise puts them back in the driver's
It's a good
seat.
feeling. It's a good feeling.
All right. How about the third step of our process?
The third ingredient in our recipe is strength.
Hey,
core
we're mixing
strength.
up a nice batch of something here.
Mm.
We're going to do cardio, which we did. We did some brain exercise, right? And then we're going to do some strength work.
Yeah, let's do some
I
strength.
tell you
work.
what, Jackie, just for you, I'm going to do what you love best.
I hope. Is it a plank?
Planks a lot. Yeah.
Planks
there
a
we go.
lot. We
I'm
love
going to hit the
plank.
floor. Are you going to do off a chair?
I'm going to hit off the chair.
Okay, so here we go. At your own level, you know, everybody out there can do a plank. If I go against a wall, gang, it's still a plank. All right. So let's see if we can go against the wall. Maybe it's the top of a chair, back of my nice heavy couch
Sure.
or kitchen countertop. Hey, you know what? Everyone's going, you know what, Zitty? I got more for you.
Bring it.
Okay. So I'm going to go to the floor. Let's go 20 seconds on, 20 seconds off, just like our cardio 1-to-1 ratio. Let's do that with core strengthening.
I like it.
Here we go. I'm just going to come up in a push-up position and just hold Okay, we are on. The clock is on.
Yep. I'm on the seat of the chair. My shoulders are right over my elbows. I'm pulling my belly button in and breathe.
Hips are high, gang. Keep your hips high. Really pull your belly button in towards your spine. Whoo! Yeah, oh, yeah. Isn't that nice? Whew, what a way to wake up. That's time.
Take a breather. Hey, if you have the desire to come to a boot camp, you will leave happy.
Absolutely.
Absolutely happy.
We've got, let's see, we've got 1, 2, 3, 4, 5 boot camps a week on Zoom. We've got in-person boot camps at the gym. Here we go. One more time. I'm going to go to my elbows. I'm going to throw a toe tap in there, Jackie.
We're up. I'm going to throw a rotation in.
Okay, here we go. So we're moving now. It's a real dynamic plank. Is plank a swear word where you're coming
Plank
from?
is not a swear word.
It is where I live.
Come join us on Planksgiving. It's a good day.
We got about 3 seconds to go. Hang in there. 2, 1, and that's
Woo!
your time.
Nicely done.
Woo!
I hope you joined us.
Hey, a little bit of taste of boot camp there.
That's
just a little taste.
Just a nibble.
Yeah.
Just a nibble. Join us on another day and do the whole hour with us.
Perfect. Thank you guys so much. I appreciated that. I had to skip my 10-minute abs this morning to make it work. So I appreciate
Amen.
the planks.
It's
Always
been great. You know, I'll tell you what, we've already taught 4 classes here, all boot camps. We're limiting our space in here to 6 to 7 people. We've got 4,000 square feet. So it's very safe. Everyone's masked, everyone's boosted, all that good stuff. So please come join us.
Please join us.
Visit us at totalhealthworks.com though.
Thanks so much for giving us
Perfect.
the
Absolutely.
Nice to see everyone.
Yeah.
Oh, we appreciate you. I know all of my patients have been hunting for you, so they're so happy to figure out where you are and
Thanks,
to keep
Clarice.
following you. So
Thanks, Clarice.
You're
Yeah,
welcome.
we always hear
All
good
right.
things too.
Bye, gang.
Good. All right, guys. So Jared, we'll have you come on next. Tell us a little bit about our Live Well programs here at OSU, if you'd be so.
As always, thanks for having me. And let's all do our breath after my core workout as well. So let's take our deep breath in. Too much information today. I loved it. That was great. Let me introduce myself first. I am a physical therapist by profession, but I am promoting the Parkinson's world as much as we can. So first of all, here are some of our locations for physical therapy, occupational therapy, and speech therapy as they exist within the Wexner medical community. It's nice to bring everything together. Lori mentioned the Parkinson's Outcome Project. They came up with a very good consensus. 2.5 hours of exercise per week can make a big difference in quality of life, mobility, and ADLs, as well as caregiver strain, which was the focus of our talk today. That is a goal that we can all shoot for. 2.5 hours of Parkinson's specific exercise. Jackie and David gave you an avenue there. We have an avenue as well at Wexner that is our moving with purpose classes, our exercise with purpose classes. We are lucky and grateful to be supported by the Parkinsons Foundation community grants for our fitness classes that exist at OSU. We are also have the luxury of having speech therapists, occupational therapists, and physical therapists that get to be involved in the content of our classes and try to connect the evidence with the offerings. So our classes are free that exist in various parts of Central Ohio. And with our grandiose idea of how can we spread this knowledge of Parkinson's specific exercise to not only surrounding communities, but communities within Central Ohio that do not have the access. If we think about Parkinson's research, home exercise planning by yourself is not necessarily the most effective way to reach all these outcomes and all these benefits that exist with exercise. Due to the specific impairments of Parkinson's disease, guided exercise is actually the most effective. And plenty of research will point that out, is that we need to see, hear, and live in the experience for Parkinson's exercise. And so I am so thankful that we have the opportunity to try to expand offerings. So whether it is here at Wexner, whether it is with Delay the Disease, whether you are pursuing Total Works, there are various avenues out here for exercise and availability to Parkinson's specific, and not just Parkinson's specific because it's easy for me to say, but PSP and multi-system atrophy and cortical Basilar syndrome. These movement disorders that exist also benefit from these same principles. And it warms my heart to hear all these available resources. So if you haven't exercised and your life is not necessarily exercised previously, a good place to start is therapy. We can design a program that can get you started in movement. If you're already moving, let's move more intensively. Then we can seek out other opportunities to move more intensively. If you're moving intensively, let's move intensively more often. So as we think about wrapping everything up, Patty made a great point about aging in place. What we do today can make a big difference in 3, 4, 5 years down the road. Not only in making the right contacts for our emotional support, our caregiver support, our establishing our life going forward, but an exercise routine that gets us consistent, often, and intensive can make a great difference for Parkinson's disease. I thank you all so much for being here. I always learn a lot from these, and I'm always so grateful and the people that participate with us, and have a great weekend.
Thanks, Jared. Always appreciated, as always. We do have a few minutes, guys. If anybody, and ladies, if anyone has any questions, we'll be happy to answer them. Bring our panel back. I know a few folks have got to get going. They've got some Zoom classes to teach and some things, but you know, if any questions, please feel free to set them up there. Melinda, I did see the one question for you. So is the Dempsey Center only for Ohio Health patients? The website says it is. Can non-Ohio Health people pay to access programs there?
So yeah, everything we do at the Dempsey Center is free and open to the public. So it's open to patients and the entire community. The Wellness Center is something that you would pay for to be a part of, but the Dempsey Center, free and open to absolutely anyone. And now that we're doing our classes on Zoom as well, you don't even have to live in Central Ohio. We've had people from all over the state join us.
Fantastic, wonderful. And then Susan, I believe, yes, Susan, of course, a good question. What does the LD or the L-DOPAs mean? How did y'all come around to that name?
I love that question. When the group started, we were really trying to find a name for ourselves. One of our members at that time was a retired pharmacist, and he said, you know, dopamine is so vital for Parkinson's. Why don't we call ourselves the L-DOPAs? And it seems hokey, but it's so easy to remember. So that's how we became the L-DOPAs. Not because we're dopey, although a lot of us are.
I think that's perfect. It's a very creative name, and you're right, it's really catchy. Every time I have to make the list of the support groups, I always remember that one first. So it's definitely working. And that person had lots of insight. So maybe they should have done more marketing. I don't know. So it worked out great. Perfect. I actually don't see a whole bunch more questions. I guess just a quick, just to help patients keep this in mind, which of the groups are meeting via Zoom and which groups are meeting in person right now? So if you're meeting via Zoom, can you tell me quickly that you are meeting via Zoom?
We have a group that's meeting by Zoom the second Wednesday of the month from 11 to 12.
Perfect. Thank you, Jackie. And anybody else? Is everybody else in person or virtual?
the PD Partners Group, the one that meets on Thursday, we're doing both. So the Zoom is a little difficult, but we do have a couple of people who are joining us by Zoom, but we are also in person.
Perfect. Perfect. Okay. And then everybody else. Oh, go ahead. Sorry.
So right now, the Westerville PD group and the Central Ohio PSP group are both Zoom only.
Okay.
Also,
Perfect.
the Alzheimer's Association is meeting via Zoom.
Okay. Perfect.
And we have boot camp live, and we have all levels of Zoom.
Okay.
Lots of classes.
Okay. So.
And yeah. And then Clarice, we do have an in-person one as well. So we have one that's Zoom and one that's in person.
Perfect. Perfect. I know you all mentioned it, but just to, you know, bring it back around and remind ourselves of what's what in this world. Okay. Perfect. Perfect. Absolutely perfect. Hey, Jared, I think this one's for you, or perhaps not. Does anybody know when the Dance and Parkinson's class meets?
Yes, and so the website is going to be shared with you. It was also on the slide.
Okay.
It's up and running.
Okay.
Admission, sign up as you want, send Chloe an email.
Okay.
It's fantastic. Choreographer, she's been trained by Dance for Parkinson's Disease. Fun, joyous class that promotes community, and you know, music and movement is some people's taste and other people's not. So we have a variety of offerings. I also encourage one thing for the speaking class. It's not a lot of offering, but it's a virtual class that we can use music and movement for amplitude of voice. And so safety of your own home, and they use breakout rooms. Pam is really good with the technology. And so it is not that you need to be singing or using your high voice in front of people, but later on it does provide a nice avenue for people with communication issues to communicate with others and then establish a nice relationship.
Perfect. Wonderful. I always encourage my patients to sing as much as they like. Never hurts, always good for the voice. Perfect. Perfect, everyone. Okay. I don't think I have any more questions for any of you. Just thank you so much. Again, there will be a sheet on the website having everyone's contact information so that you can get a hold of everyone and figure out what groups to go to. I also wanted to mention there is a young onset group. It was kind of also affected by COVID, but there is a young onset group. So if you're interested in that, I will do a little more digging and figure out exactly where that is right now. But I know that with COVID that got set. So I know that's a different population that sometimes gets missed in some of the others, but there is at least one group of Central Ohio. Melinda, you may know if there's more, but there's at least one group, but it's been a little quiet with COVID. I think they're just kind of finding some new leaders and working through some of that.
I just know of the one. So, yeah.
So, and they're working through some of that. Okay. All right, everyone. Thank you so much. I have one more presentation, but you all can go relax and get off camera. But just a quick one here for everyone. So, oh, perfect. It's already up. Thank you so much. So I am just going to I try at every presentation to give our research information. And so this is just our research update about what we're doing over at Ohio State. So of course, there's an estimated 10 million people living with PD worldwide. You've seen lots of these numbers today. They change over time. But still, one of the biggest problems is that we don't have a large amount of folks that have PD that are in research. And so we try as much as possible to help you see how you can help in the future and kind of guide us through. As you'll see, it's pretty low numbers. Trial enrollment averages only one patient per month for most studies. And it's really hard for us to get new data, look for cures and things like that. So it's a coordinated effort through lots of us. And again, it helps to make these new treatments that help with lots of things, lots of different parts of the disease and different aspects of the disease to move things forward. So next slide, please. So these are the trials that we currently have at OSU. And I will go through all of them just a little bit. I believe there's a slide for each one of them. So let's start with, we have trials for patients just as they're starting with the disease and as the disease goes on. So we'll look at these, we'll go in order. We'll look at the early PD trials. So there's the PRISM Parkinson's Research Trial, and it's looking for folks, they've got disease within the past 5 years. Thank you. Who aren't, right there, perfect, who aren't taking any medications. This is always a tricky trial for us to get patients in because usually our patients are taking medications or need to take medications when they've come and seen us, but we would be remiss to not offer this to folks. Can you flip back one slide for me, please? Thank you. Perfect. Okay. And so this is, of course, trying out a new drug for us. There we go. Perfect. And we're trying to see if it's going to slow down the progression of Parkinson's disease. And patients who enroll in this trial, they're testing to see how quickly I can keep up. Patients enroll in this trial. They'll receive a weekly drug by subcutaneous injection. Subcutaneous injection just means that it's going to be under the skin. It's not going to be a long needle that goes into your muscle or anything like that, but it's going to be a small one. You can leave it just like that if that's working, if that's working. But we have to go back one slide. Thank you. Okay, and it's over a period of 36 weeks. There is also the Tempo 1 trial. Tempo has 3 different parts to it, and it is really a great set of trials. So this is also for folks with early disease, diagnosed within the past 3 years here, again, who are not taking levodopa or dopamine agonists to treat their or manage their symptoms, which again is a small group of folks. But if you know anybody, please, shoot them our way. This clinical research study investigates this investigational drug to see if it improves PD symptoms that impact movement and daily activities. There is a 27-week trial treatment. So if you were in the placebo group, meaning that you weren't getting actual drug, or even if you were, there's an open label extension, meaning that you can either continue taking the drug or ensure that you get the drug for additional 58 weeks, which is a very long time, as we know. So we can see how this drug works over time. And again, that drug is to see that it helps with movement and daily activities. The PRISM trial is to see if we can slow down the progression of Parkinson's disease. Both of those trials, again, are for patients who have not taken any Parkinson's medications at this point. Next slide, please. There are also still advanced research trials, one of which is Tempo 3, still with it investigating the same drug. This is a really great opportunity for a lot of my patients, which we often will use Rytari, but trying to remember to give this to everyone who's having motor fluctuations. So if you're having on and off time, and you're taking carbidopa or Rytari, well, carbidopa, levodopa, so Sinemet, or Rytari, which is also carbidopa, levodopa, and your medications are still wearing off. So it's again looking at that same drug that we were just talking about to see if it can extend how long your carbidopa, levodopa works, reducing your off time. So again, a 27-week treatment period. I can't remember, but I believe this one also has a placebo period as well, so don't quote me. But again, you can go into the extended open label portion. So if you were getting placebo, you have the opportunity to get drug. And if you were getting drug, you have the opportunity to stay on drug, again, for the additional 58 weeks, which is a long time. The ADX trial is a great trial if you are having dyskinesia. So if your carbidopa, levodopa, or the medications we are giving you to treat different diseases, or to treat your Parkinson's disease, is causing you those dancing movements where you can't sit still, This is a great trial. Tricky part about this trial is that you cannot be on amantadine, or if you are taking it, you have to be willing to be off of it for the duration of the trial, but also I want to say 6 weeks, don't quote me exactly, but a certain number of weeks before you can start this investigational drug to see if it'll work. Of course, that's to see if this drug is actually working. If you were on the amantadine, it would be hard for us to tell which one was working. So there's a 4-month-long study for this one. And then again, you have the option to enroll in the open label study. So if you had placebo, to go on drug or to stay on drug for another 12 months. So that is, again, a drug to help with dyskinesia. The ADX study, the Tempo 3 study that I just spoke of, again, is to help with off time. It's a medication to see if you can have more on time. Those are 2 drugs for kind of our later stage patients at this point. Okay, next slide, please. The advanced, one of them, again, advanced stage, we have the GDNF PD clinical trial. So you've got to have PD and have been officially diagnosed for at least 4 years ago and have moderately advanced symptoms. This is a tricky trial to get into. I will preface it with that. But it's a research study evaluating some gene therapy to assess its safety and tolerability. So to be clear, it's also being tested to see if it can slow down the progression of Parkinson's disease, but this particular part of the trial is not for that. It's to assess the safety and tolerability. It's a long study. It has a lot going into it. It lasts 5 years. And you have to have surgery to deliver the GDNF to a specific part of your brain. So it's going to involve a brain surgery. Of course, if you have DBS, this is not one that you will be eligible for in trial, but that doesn't mean, you know, later on if it becomes a thing that you won't be able to do it. There are 15 visits required, most of them within the first 2 years. But that's one of our gene therapy studies. Next slide, please. So some other options that we have are also the NeuroNext study. So this is our only Parkinson's and sleep study. It has a good bit of visits to it, but it's to find out if light therapy can help people with Parkinson's disease who have trouble sleeping, which I don't know that I have any patients who don't have at least a little trouble of sleeping. They also want to make sure that it's safe and doesn't cause too many side effects. So study participants, you will get a sun ray light box for light therapy and of course instructions on how to use that, and they'll be following you to see if it improves your sleep. Here again is another reference to the PD generation, which is what the Parkinson's, Lori, thank you, Lori was talking about earlier with the Parkinson's Foundation. It's our genetic registry whose aim is to create a generic data and sample repository for Parkinson's disease and future research. And this is a really easy study to be a part of. I encourage all of my patients, DBS, no DBS, anything to be a part of. It is simply typically it's 2 visits for us over at Martha Morehouse. The first visit, they're going to, of course, consent you, give you all the details about the trial, which they'll give you more of those even before that step. The neurogenetics counselor, again, Victoria Klee, she's going to come out, talk to you about what it would mean for you and your family if you came up positive for one of, I believe, 7 different genes that they'll be testing you for. And then they'll draw your blood. If it's negative, they'll often call you. If it's positive, they'll bring you back in and offer you the opportunity to talk to Victoria again. To talk about that specific gene and what that means. If it's negative, it's not a bad thing. We're typically also registering you for the next trial on there, the NRIBBB study. And it's just a biorepository, meaning we'll keep some more of your blood and sometimes tissue, but right now I think they're just doing blood. They're not doing anything else. And to help us figure out some new research moving forward. So, you know, if there, as we genes, I'm so sorry, that was not poorly worded. As we figure out other genes that are related to Parkinson's and our are Parkinson's genes, they would call you and say, can we run your samples again against these new genes to see if you have a type of these. And a good question is, why would you want to do something like that? So if you are positive for one of these, of course, you're going to go into a database. And as the field is really moving more into genetic treatments, so you will be first called when they have another trial that they'd like you to be in for that specific gene with Parkinson's. So you will be top on the list for that. And that's a really good thing. The other thing is this helps us to get a better idea about biomarkers. One of the struggles in Parkinson's disease right now is something called a biomarker, which can be tricky to understand, but at its base, we need something that tells us when we give Parkinson's patients these drugs or treatments that they get better. And right now we use, the scales that we often do for you in clinic, where we have you tap your fingers and, walk and different things like that, but that's a little bit objective. It is objective, but somewhat subjective as well. So biomarkers are just things like blood or spinal fluid that we can actually measure and say, yes, your Parkinson's got better, or no, your Parkinson's didn't get better. And that helps us to find treatments much more quickly. So enrolling in either one of these, either one or both of these trials, the PD generation or the NRIBB really helps us just for, with some blood samples. It really helps us with working on a cure and finding better treatments. So please, please, please think about being in that trial. We're also particularly interested in patients who have had DBS and their genetics as well. As Lori alluded to earlier, genetic testing is usually tens of thousands of dollars for patients, so it's not something that we do on a routine basis because it wouldn't change how we treat things. But as we learn more and more, we'd like to know how some patients respond to DBS depending on their genes. And so that could be really helpful for us as well. And that is one of the trials when you have DBS that you're able to participate in. Next slide, please. Okay, so these next trials are related to patients who have deep brain stimulation and are going to be recently implanted, or newly implanted, I should say. So there are 3 companies that make DBS, which is a whole different story. But 2 of those, the 2 newer companies, Boston Scientific and Abbott, both have very easy trials to be enrolled in. So if you're going to have DBS in the near future and you're going to have one of those systems implanted, these are easy trials. You're going to do the same thing you would do if you came in anyways for your DBS for programming and things of that nature. Maybe you have to fill out a couple of extra questionnaires, but it's very simple and they will pay you every time you come in. I forget which way it goes, but one of the trials gives you $50 and one of the trials gives you $75. Again, helping us to learn more and more about DBS as time goes on. It's just a registry. It's very easy and it's very impactful for us in research and future treatments, particularly regarding DBS, which is changing very, very quickly right now. So this information is really critical and crucial for us. And then one of our easiest trials, any of our patients that have a movement disorder, including Parkinson's disease, can be a part of this trial. It's again, another registry. It's just an Ohio State trial, but we are keeping more organized information on each of the patients that we see and treat. You do have to enroll in this trial. There's a consent form, but essentially this actually requires absolutely nothing extra from you. It is just gives us the ability to use your chart and make trials later. Maybe we want to look at patients, young onset patients, and if they did Rytary or Cinemet, we're able to comb through your chart and use data for that. We may ask you to walk up and down a gate mat, but that's becoming more and more normal, actually, more of a not just research, but everyday part of clinical practice and care for Parkinson's patients. So really, there's not any extra things. There's no treatment. And it's just information that we collect at normal clinical appointments. And sometimes an extra assessment, again, walking up and down a gate mat, maybe a more routine cognitive test, which we should be doing yearly anyways. So that's a really, really easy trial that you can be involved in here at Ohio State that we much appreciate. Okay, next slide. Okay, so yes, those are the current trials. We have a few more coming down the pike. COVID has slowed some things down, but we should have some more trials coming in the future. I will always keep you up to date at these meetings about what is the new and exciting thing. If you saw any of those trials and they piqued your interest today, or you just want one of our coordinators to keep your name and information on a list for trials as they come up, if you're interested in research for Parkinson's disease, but none of those trials particularly related to you or your disease at this time, please just send an email right there to the pdresearch@osumc.edu. Our research coordinators are great. They will always reach back out to you. That's an excellent way to reach our research team. If you ever have questions about trials that are coming up, that are currently going on, or again, you just want to be on our list to be contacted whenever a clinical trial that you may qualify for would come up. And that's a perfect way to do that. Next slide, please. Okay. So that is all that I have for everyone today. Be sure to check in on our website to learn about updates in our Parkinson's disease program. Give us a little bit of time, but we will also post today's session in a printable handout with information from all of our speakers, those caregiver groups, and resources how to contact everyone. So those will all be there as well. We invite you to join us for the next session in this virtual education series on Saturday, April 29th. Jared, I am going to hand the reins over to Jared for that one. It's going to be a great session, everyone. It is going to, actually, Jared, you can give them a quick update about what you're going to talk about in April, if you would.
Totally, yes. So we're talking about adapting the environment. All this technology exists, we have Alexas, we have smart light bulbs. How can we bring adaption to make life easier in the home, as well as we'll do some adaptive walking with Nordic poles. And we're going to incorporate a little bit more movement into the next one. So, exactly. So everybody stay tuned and come see us in April.
Perfect. Thank you so much, Jared. So that's coming up in April. There will, of course, be one later in the summer where we will be introducing some more exciting things. Hopefully some more physicians coming onto our staff. We'll introduce you to some of those. And hopefully we'll have some more information about the multidisciplinary clinic where you can come see us and see all these wonderful team members that I've been discussing all in one fell swoop, as opposed to coming forward and backward to our clinic several times. But more details to come on that. Thank you all so much for participating today. Thank you for attending. We look forward to seeing you in April. I have one more small request from you. There is a survey that they will give you. I am hearing a lot of feedback from my patients that these are long sessions, and I completely agree with that. So if there's another format, maybe you want just an hour a month, or during a weekday is better than the weekend, or any thoughts that you have, we do take those to heart, and we try to make these sessions geared towards everyone. So if you have any thoughts or any topics or anything that you would like to see in these sessions, or any changes you can think of, please let me know. I am always happy to make those adjustments as much as we're able to. And again, thank you for sharing your Saturday morning with us. I know that it was long, and I hope that you got some good information out of it. And don't forget about our clinical trials. Send us an email. Let us know if you're interested. We're happy to reach out and talk to you about that. So again, thank you so much. Thank you for letting me go 4 minutes, almost 5 minutes over time, and enjoy the rest of your Saturday. Bye-bye.